All right, good morning, everybody. Sorry about the delay in getting started. We are still working on health care. Unless any member has anything you need to say before we get started, we can turn directly to page 42. And in accordance with Mr. Lowenthal's request, I'll read the item title and the amount of savings that's proposed. This is an LAO proposal for additional savings in the GHPP. And forgive me, I don't know all the acronyms, so I'll simply read the acronym, by acceleration, and it's proposed $400,000 savings. So LAO, would you please start us off with a brief discussion?
Yes, thank you, Madam Chair. Good morning. Farah Brock with the Legislative Analyst's Office. The February budget proposed enrolling additional persons with hemophilia into private insurance, employer-sponsored insurance when it was available. They would do it for approximately 11 people next year, 9-10, so they would be enrolling one additional person per month. What we're recommending is that they ramp up their efforts a little bit and enroll 2 people per month in private insurance. This would save an additional $400,000 general fund. The department has plenty of experience in doing this. They successfully do it for beneficiaries in the Medi-Cal program.
Any discussion on this item, members? Any comment from the DOF? Okay. It's been moved and seconded, and yeah, we're going to have to put this one on call since there's only 2 assembly members here, and you're missing 1 member too. So would staff make a note that when we have everybody present, we'll bring this back?
But take the vote, put it on call. No,
We just have to take it twice then. All right, 4020, fine. But we'll bring it back again to... Actually, can members just add on? We don't have to come back and vote on this, do we? All right, we'll do it formally so we can record the vote formally. So we'll come back to that item. Page 43, eliminate general fund support for clinic programs for savings of $34.2 million. Mr. Blumenfield. We can close an item out if we can have you add on to the vote right now. It's on page 42. And Mr. Dutton's here. So all we need is an aye. All right, Mr. Blumenfield is an aye. Mr. Dutton? Mr. Dutton's an aye as well. Thank you. All right, we're on page 43. We're moving quite right along here. LAO, the only thing, well, personally, what I would like you to explain is how much of this is general fund money.
Of the $400,000?
And we're talking about a temporary suspension, right?
43.
On page 43.
Oh, I'm sorry. How much of this is general fund? It's all general fund.
And you're proposing, your alternative is a suspension for 2 years, not an elimination.
Correct. The administration had proposed to eliminate it entirely. We would suspend it for 2 years. The Reinvestment Act, the federal funds that are coming in, provide about between 73 and 100 million in additional federal funds to the clinics over the next 2 years. As you can see, this over 2 years would be about 64 or 68 million. So it's a roughly equivalent amount of money. The federal funds were intended to provide funds for clinics that were going to be treating an additional number of people. So this would just keep clinics with a flat level of funding if the funding was eliminated.
Okay, and your alternative also scores an additional $1 million in savings by eliminating some state staff.
There are about
for
22 and a half staff at the department administering this program. We were recommending eliminating the staff for $1 million savings.
Members, discussion on this item, my recommendation would be to take the LAO proposal. Ms. Ducheney and then Mr. Blumenfield.
I appreciate what they're saying, but I don't know that. I guess I need to see all of this health care in one big package, because this, to me, is the most damaging if we are doing some of the other things that are in here. These are the places where uninsured folks go. If we are going to be uninsuring people, if we are going to be restricting healthy families, if we are not going to have Medi-Cal services available, if we are not going to have some of the other services available, then we are creating a very large pool of uninsured. And the clinics are the place where people go. And they do sliding scale, and they manage to do preventative health care. And to the extent, for instance, a proposal yesterday to limit newly qualified legal immigrants to emergency services is very expensive, instead of providing regular preventative services. And if we were to do that, which we haven't agreed to yet, then this becomes more important. So I'm a little torn on the balancing side of this one, especially in the rural areas, the Indian health clinics, the migratory clinics. I get the piece with the federal funds, but I don't know that it went to everybody. I mean, my sense for the federal funds, what they were grants. I know in my district, I have a lot of large clinics, and a lot of them got some, but it was all varying amounts. Some clinics didn't apply, some didn't qualify. It's kind of all over the place.
It is.
And if we're, for instance, looking at the small rural hospitals yesterday, if we keep the clinics open in those areas, you have a little better balance for them to be able to move things. So, Madam Chair, I appreciate the notion that that's a compromise, but at least I'm not prepared to close this item yet.
Mr. Blumenfield?
Okay, I mean, sharing a lot of the concerns of the senator, but I just had a question about the percentage of operations. How much are we talking about? I know you said it kind of keeps it flat with the proposed cuts, but what is 34 million as a percentage of the overall operation?
The proposal from the administration would completely eliminate the grant funding for several of these clinics. The clinics would also be receiving other funding potentially for their operations. It would vary depending on the clinic and what their other sources of revenue were.
That's what I'm trying to get a gauge on are these clinics completely dependent on this funding? Or is this just a tiny portion of their funding?
I don't know. I would imagine in almost all places it was a portion of their funding and not their exclusive funding. This is hundreds of clinics that this money is spread over.
Is there a way we can get a little bit more detail on that? I mean, in terms of, because if we're cutting their fund, I want to know what the impact is to that whole, not just, obviously we're eliminating the state funds, but what is it doing to the program?
Mm-hmm. I think that's something the Department of Health Services might be able to provide. I'm not entirely sure if they have that level of detail clinic by clinic.
Toby Douglas, Department of Healthcare Services. We can look to see if we have it at that level of detail. It does. The factors that we'd have to look at are these clinics are all, for the most part, federally qualified health centers or rural health centers, so they are receiving Medi-Cal reimbursement. It really varies to the extent their population they're serving is Medi-Cal versus uninsured, how much they're getting from these other funds. And then as Senator Duchesne mentioned, it dependent on whether they received the ARA funds. Not all of them did receive funding from that source. It varies. We can try as much as we can to get you a better picture. It will be hard on this on the individual clinic level to do it. But
Even if you can't get the dollar exact percentage, just ballpark. I mean, I don't know if we're talking about 2% or 98%. So I want to get a better
we can
picture in terms of each of the ones that we're proposing the cuts to.
Mr. Nielsen?
This may be a small factor, but I'm trying to come up with some ideas that would be constructive, and Senator Duchesne and Assemblyman Blumenfield as well, I think. Is there any room here in terms of their cost-based reimbursement, to the reimbursing schedule that would save the state a little bit of money? Could that be revised or reviewed? Could that be considered? Maybe that hits them a little bit, but it keeps them at least going from their other sources and doesn't hit them as hard from the state perspective. We may not save as much, but is that a consideration?
Well, first, I do want to just follow up on Mr. Blumenfeld's question. These funds are small in the aggregate. I'll get you the percent, but we're not talking about big dollars compared to the Medi-Cal funding that they are receiving. When it comes to the question about Medi-Cal prospective payment system, the cost-based reimbursement, those are tied in federal law. The state does not have much control over being able to change the adjustment that goes on every year. There is a cost of living adjustment that gets built into the formula. There are requirements on how the cost-based methodology is put in place. The only way that could be changed is through a waiver from the federal government.
Probably not enough money then here saved to go through a waiver process then? Is that what you're suggesting? And I know waivers are not easy to obtain.
It's not there would be savings if you move to a new system. It's just it would be no other state has received such a waiver on their system.
Okay. Thank you.
All right, members, I was ready to act on this because the LAO is noting that many of the clinics receive federal grant funding and that there were substantial ARA funds from the federal government available for many of these clinics as well. But if the consensus of the committee is that we want to keep this open and get more information, then that's what we can do. We'll just have to come back to it again next week.
We're ready to support it on our side.
We're not.
All right, your Democrats are not, your Republicans are.
That's the way it works.
So I have a feeling that if we moved it, it would fail. So let's leave this item open and come back to it and move on to page 44.
Which is the
Eliminate Proposition 99 funds from the expanded access to primary care clinics to backfill general fund and Medi-Cal. This item relates to issues below where I believe the actual savings are scored, because there's no dollar amount noted here on this page. So, members,
Well,
discussion? Mr. Cheney?
I guess, these two are related, and it goes to the larger 99 question. And it's just, we can close all of these probably all at one time at some point, but we need them all put together. And I would suggest to staff and the LAO, looking at it this way, you look at, are we making the 99 shift, or do we keep some of this in 99? What do the EAPC clinics versus the Indian Health and Seasonal Migratory and Rural Health Services, who are more limited in their assets, if you will, and how many of them got whatever from the stimulus money? This is core safety net from my perspective, because these are where everybody goes when they don't have health insurance, and it is where Medi-Cal and Healthy Families children go. So it relates, members, to how do we solve some of those other issues, because to Mr. Blumenfield's question, if they don't have Healthy Families and they don't have Medi-Cal, then they really need this money. If we're going to preserve pieces of some of those other portions, then maybe some of the general fund could be reduced. But we need to put it all in context, and we need to both solve the 99 issue. Maybe if we are shifting this, I assume you're shifting it to something like emergency services. That's usually where it ends up.
Shifting it to the Medi-Cal program.
It goes to Medi-Cal. So, maybe that's appropriate, and then we reduce some of these other sums by some amount. But I think it needs to be a package, and that's the only reason we're hesitating here, is because I think we need to see that as a whole package and understand what safety net services are going to be available to people.
So when this comes back to us, we need to
come
see the
together.
whole package. We need to see where the funds are getting proposed to be cut or eliminated, where they're being shifted, and where there are federal funds available. All right. Without objection, then, members, we'll move to page 45. State staff for Medi-Cal for a savings of $207,000. Excuse me, not a savings, an increase. And it's a request for 7 additional positions. Discussion, members? To me, there's possibly a difference in the 3 different programs. I wonder, LAO, could you just briefly summarize? There's 3 different programs for which there are 7 additional positions being requested. And it seems to me that item 1 might possibly have some merit, but item 2 and item 3 are questionable to me.
Item 1 is to implement an incentive program for providers who are going to start using electronic health records. This actually wouldn't have a general fund cost. The California Healthcare Foundation is providing a 10% state match with the federal funds. This will likely be continuing for the next 2 to 3 years, so these positions would not be a state cost, and we would recommend approving these positions. The next 2 are additional positions that would be added in the Medi-Cal Managed Care Division. These staff would be helping to process capitation payments. They would also conduct financial audits of managed care plans. We're recommending not approving these additional 4 staff. We believe that they have adequate staff right now to absorb these activities, and perhaps in the future this could be reconsidered.
Sorry, I just realized I stated it backwards. Item number 1, because it has no general fund cost, seems to be perfectly appropriate. And item number 2 and 3, because they do have general fund costs, would seem to be, I'm skeptical about them, and I'm hearing a consensus.
Madam Chair, I'll make that motion that we
Yeah.
accept 1 and reject 2 and 3.
Second? All right. Without objection, then, the vote will be 5-0 on 2 and 3, and we would reject number 1. Sorry. Yeah. Yes. Approve number 1, reject 2 and 3. Thank you for keeping me on track. Page 46. Extend clinical positions for ICF-DD nursing pilot program for a savings of $81,000. Or no, for an additional increase of $81,000. It's an increase of $81,000 in general fund monies to extend 1.5 limited term positions for another 2 years. Again, I have the same skepticism on this issue.
Can I finance?
This is workload
Is there
associated.
out-year savings on this, though?
This is workload associated with a cost-effective waiver that we'd like to continue. We're drawing in really significant amounts of federal funds to reduce our costs in the DDS system and in regional centers through waivers that the Department of Healthcare Services does a lot of the staffing with the federal government on. We would see this and the other prior positions as cost containment positions.
Does this have out-year savings? I mean, do we expect out-year savings? If not current year's budget year savings, do we expect out-year savings by keeping this pilot alive?
It would be cost avoidance in terms of continuing this pilot prevents everyone from going into the institutions or being able to keep them, transition them out of an institution into this pilot. So from a sense, it would reduce any savings or reduce any costs in our program in future years.
We're okay with it.
Mr. De Leon?
Is this something that could be easily absorbed into the workload?
We think we need additional extension of the positions in order to be able to do it. The department is managing many unallocated reductions, and we believe we need the resources in order to do this workload that, as Mr. Douglas mentioned, is going to result in cost avoidance in out years in the DDS system.
If we don't approve this, then we would get into the cost avoidance issue then.
We need the positions to do the workload.
We would be at risk of not being in compliance with the federal rules, and they might discontinue the waiver.
And if you didn't have furloughs in that department, how much would you really need the positions? Just asking.
Just a rhetorical question. Mr. Leno?
Thank you, Madam Chair. I don't often get to agree with the administration. I wish to on this one. It is relatively a minor amount of money, and given that the developmental services are at risk of significant cuts, this is one where we can, with a very tiny bit of investment, as we've heard from staff, suggest that we will avoid some additional costs down the line. So I think this is supportable.
Well, Ms. Ducheney actually asked a really good question. And are these new positions going to be subject to furloughs? I assume they would.
The furloughs are statewide and apply to all
Right, so they
positions,
would.
and as in your February budget scored a substantial amount of general fund savings associated with those furloughs. Those furloughs and those general fund savings that were assumed in the February budget package affect all the general fund positions and all special fund positions across the budget.
Now, that I understand. The problem I'm having conceptually is this item and a number of other items that are coming up next ask for increased positions to do things like, investigate fraud and that sort of thing. And if we're subjecting our state workforce to a 2-day furlough a month, I'm wondering how truly effective these things are going to be. And so we're going to have to discuss this as we look at some of the items that are coming up next. And I do have a question on this one. This is a pilot program. So is this a pilot program in a particular geographic area, or is it statewide?
It's statewide, but it's limited by the number of sites that we have.
So where are the sites?
I'll have to get you a list of it. We have about 6 different sites throughout the state, and I can get you the full list.
All right. Well, it sounds like the Senate wants to take it. I prefer to deny it. Mr. Nilo.
2 issues. First of all, what are the number of vacancies in the area that we're dealing with here?
The department across the board has a vacancy rate of around 5 to 6%, and the vacancy rate is the vacancies associated with being able to manage to the level of resources that they're provided in the budget. So it's their salary savings position is the vacancy rates, and it's roughly 5 to 6% across the department.
In other words, the positions are purposefully not filled.
They're vacant because there isn't funding to fill those positions. So it's the vacancy rate that they have to manage to in order to not exceed their appropriations.
And perhaps we ought to eliminate those positions. But the other point that I wanted to make, it's my observation that we're saying that this work is very high priority work, and yet we're asking for additional resources on top of existing resources to fulfill a high priority effort. If it's a high priority effort, I would think that you would get it done within the existing personnel, especially if other issues are of less priority. I realize that as an administrator of the organization, you'd rather have the luxury of the additional positions, but if it truly is high priority, it ought to be done not necessarily at the expense of other work, but with existing resources to make sure that it does get done.
Mr. Dutton, did you have a comment, or were you just indicating a position? Okay. All right.
And these are existing positions. It's extending the limited term positions due to the fact that the workload is continuing.
It's been moved to reject and seconded. Without objection, we'll do a 5-0 vote. All right. We'll move on to page 47. Well, this is the problem in a number of these upcoming items. 47 is Medi-Cal Provider Enrollment Automation Project for an additional cost of $501,000. And this is another one where I have an issue with, well, first of all, enrolling new Medi-Cal patients when we're cutting down the program. It just doesn't seem to quite compute. Other comments, Mr. Blumenfield?
I had a question. How many providers are we talking about?
What this project is doing is trying to streamline our provider enrollment through an automation project. So we're moving, right now we have a very intensive paper-based enrollment process for providers that costs a lot more for the state as well as for providers. We're moving to an automated system similar to what you would do with TurboTax or any other where it's online, they can fill it out. So over the long haul, this will create a more efficient approach both for the providers and for the state. We have had a procurement process that has been delayed. This is moving funding that was used, earmarked for the current year to the budget year. So it's been a savings in the current year and move it to the budget year.
Okay, and again, how many providers, are we talking about enrolling?
Well, we have over, in our program, we have over 100,000 providers.
Okay, of 100,000.
Yeah.
The request is for $500,000. So theoretically, and I don't know if this is realistic or not, but 50 cents a provider, you would have this covered if you had a fee of 50 cents. Is there some way to do some sort of structure like that where you can get this paid in that way, in a way other than through the traditional general fund?
I'm not sure from the federal rules if that's allowed. We can look back and see if there, and get back to you on whether we could assess fees on our providers to participate in the program. I'm not sure around the federal rules that.
Yeah, and if not fees, maybe it's not realistic, but all I'm saying is you got a very large pool, and the amount of money that we're talking about is relatively small compared to that pool, so maybe there's some other way to absorb this cost. And I'd be interested in different opinions about that, the LAO and others, if there is some other way to do it.
Mr. Cheney? Oh,
I don't know that there's another way to do it other than if we could assess the fees under federal constraints. And we do get a 75% match for this project. And generally, we are trying to encourage providers to enroll in the Medi-Cal program since typically our reimbursement rates are low. I think we'd be concerned about things that might discourage them from enrolling.
Mr. Cheney?
I guess forever skeptical of IT projects that haven't worked. I've seen that term off-the-shelf software before. It's never worked yet. We're still waiting for the off-the-shelf software that was going to solve all our fiscal problems for a couple $100,000. And I just don't know what the trust level is on this. What is the Office of Information? I mean, the problem in the original delay was the procurement process, which is part of the reason we did the reorganization. I don't know that I have any confidence level. What happens if we just delay it another year? I mean, somebody's getting enrolled somewhere now. What are they doing now?
Well, if we delay, we'll be continuing to use a intensive paper-based process, which we continue to hear from providers, the frustration with the delays and the application, that we have to return applications via the mail. So this would be trying to move it all through a real-time electronic process. If it's delayed, we'll just be more in an old, antiquated approach for a longer period of time.
On the other hand, if we delay this and it allows us to have the resources to actually provide the Medi-Cal services, that might be helpful. I mean, I get that we need to do this. I don't know if there's another way to cut this pie up. It's slow and fast, and I don't know what stage of the IT procurement process. It's not a real trustworthy process at the moment, and I get that we want to do it, but we need a CCMS system in courts, and we need a CMS system in prisons, and we need we need the finances, computers to not have to, to get forwarded. I just don't know where it fits on the laundry list of priorities in the overall IT scheme.
And all of our IT proposals across the budget have been reviewed by the OCIO and have been supported. All of our proposals are consistent with the recommendation and review of the highest priorities IT programs across the state.
Mr. Leno.
Thank you, Madam Chair. Just to review, this money was appropriated already, and only about $370,000 of the 2.4 was actually incurred in expense. So can you explain what the delay has been, if it's of such priority right now?
Sure. The delay has been through the procurement process. The delay with getting the bids in, some of the questions about the responses from the bidders has delayed the process, where we're going to have to do some changes to the bid process. It's been unfortunate, but we want to get the appropriate proposal in. We don't want to put in a system that doesn't work or doesn't meet the needs.
And might that delay continue through 9/10 if we were to reappropriate this?
We hope that's not the case. We want to get that. This has been a long overdue project that we're trying to get up and running as quickly as possible.
Madam Chair, I have to return to my Public Safety Committee, cast some votes, so I'll be back hopefully in just about 5-10 minutes.
All right, thank you. Mr. Cheney.
Well, that scares me more. I mean, we don't know. We have to rebid the thing, and we're already appropriating the money, not knowing what the bid is. I mean, why don't we get the bid first and then find out how much we need to spend in this current environment, and in what timeline order we need to spend it in? I don't kind of get spending it all before we know what the project is.
Members, this is another one based on the discussion that personally I would vote to reject. Seeing heads nodding. All right, so can I have a motion? It's been moved, and we've got a 4-0 vote on the Senate side and a 5-0 vote on the Assembly side. And we'll allow Mr. Leonard to add on later. And that's a standing rule of this committee. If you're out of the committee, and because you have to go take care of your own committee business, then we'll allow you to add on, unless it causes a split. We need you to pass it. Okay, let's go to page 48. Increased staff for audits and investigations branch for ADHC, physician and pharmacy anti-fraud efforts for an additional cost of $2.9 million. Excuse me, yeah, $2.9 million. This is another one that I just have to express the general concern that, with furloughs 2 days a month, that impacts our ability to perform these investigations. And I'll ask the LAO for a comment, and then perhaps the Department of Finance can address my concern after that. So we'll start with the LAO.
Thank you, Madam Chair. I'm going to break my comments into 3 parts to address the 3 different groups that the fraud proposal is going to try and reduce fraud in. The first are the physicians. They've got a few moving parts in here. One of them, they would send out a report card to all of the providers, the physicians, that would basically let the providers know how they rank in comparison to how other providers are, say, providing antibiotics if a person has a cold or something like that. Combined with that, there would also be educational efforts to educate providers on the proper way to prescribe and then the proper way to bill for certain prescriptions to make sure that how providers are delivering services is consistent with other providers. There would also be staff provided to go out and do surveillance and data mining of physicians to really look closely at their practices. And savings would be generated also by decreasing the use of medically unnecessary services. The department's requesting 26 staff for this. We're recommending the approval of only 4 of the staff. We think that the provider report cards are a good effort and would help educate providers, physicians, about how they are consistent with their peer groups. We also think some of the education would be necessary, but we think it can be done with significantly less resources by perhaps doing an online training program where they could just go to the department's website and learn about good prescribing practices. We're recommending achieving the same level of savings as the department proposes. So with a 50% federal match, this would be savings of about $21.3 million general fund. On the pharmacy side, this would be conducting provider re-enrollment. So providers of incontinence supplies is the primary one, and perhaps some other providers would be re-enrolled. When the department has done this in the past, they have eliminated some of the more fraudulent types of providers. All of the savings in this area in the budget year 910 would be attributed to this activity. This would be savings of about $10.3 million general fund. It would require no additional staff. Another component related to the pharmacy is they're requesting 16 additional staff to do what they're calling a beneficiary lock-in. So this would lock in a Medi-Cal beneficiary to a particular hospital or clinic, a particular physician, and a particular pharmacy. Other states have done this effort. It has achieved some minimal levels of savings. I think the intent is good in terms of trying to make sure that a person who is receiving benefits that are inconsistent with their peer groups, that's kind of ratcheted in. But there are better ways to go about this that could actually ensure that they're getting medically necessary and appropriate care. So we're recommending not approving that portion of the request. The final one relates to the adult day health care centers, which we discussed yesterday. And they're requesting 20 additional staff here to achieve savings related to doing on-site TAR reviews, as we mentioned yesterday, and also doing some other sweeps of providers. I think the ADHC component really needs to be looked at in conjunction with the other ADHC proposals out there. So I'm not really going to weigh in on that one at the point. That one may be better dealt with as a package. Are we eliminating? Are we capping? And when we get to that point, we can work on it then. Thank you.
Department of Finance.
Generally, this proposal is part of several anti-fraud efforts in the Medi-Cal program and the in-home supportive services programs, and efforts to make sure that we're targeting areas where through our error reports we've identified that we have problem areas and we're trying to achieve some savings. The resources are required in order to be able to implement these reforms and to be able to achieve the roughly $67 million in savings. To the question of furloughs, we are managing 2 furloughs to achieve the general fund savings scored in the Budget Act, and we are managing to them in a self-directed way to try to have staff use furloughs in lieu of other leave time in a manner that has as little program impact as possible and consistent with the general fund savings that the budget assumes.
Mr. Cheney.
Well, 2 things. I'm prepared to move the LAO recommendation and move the adult day question to resolving the adult day. It doesn't make a lot of sense to hire people to do fraud in adult day if you're trying to eliminate the program. So I'm not sure we're prepared to eliminate the program, but the LAO is right. The context is, how do we constrain the program if we're not going to eliminate it, and that's where the fraud discussion goes. So if we put the adult day question over to, let's call it adult day package, then the LAO recommendation makes sense. And on your other question, I guess, and I asked this last week, and I don't know if somebody's working on these numbers, but I think the biggest concern we have with this furlough thing, besides adding new positions when we're doing it, is ensuring that those savings are real by virtue of you not creating overtime and contracting out services to replace the furloughed time. It's not that we object per se to the notion that there's a furlough, but I'm not sure the savings are real if everybody's doing overtime to make up for the fact that folks aren't working. And if we're losing federal funds because people who are totally federally funded are not working. And I think the question there isn't, should there be that tightening? The question is, are those savings real if you are actually doing overtime and contracts? And that's the information we're still waiting for on that. And in the meantime, new positions are unfavored, but I think the LAO makes a good point. And if these create savings, it's just like new positions in, franchise tax boards sometimes are necessary to be able to collect what's owed to us. So So I move the LAO recommendation and that the adult day issue here go to the adult day package.
Okay, that's been moved. I will simply say I personally am not ready to approve new positions for the reasons I've already stated. Mr. Nielsen.
Well, I would concur, Madam Chair, with your observation. I'm big on fraud. I am a lifetime member in the Welfare Fraud Investigators Association because I said it'd take a lifetime to do anything in the area. But I do believe that there could be a redirection of staff for these particular positions. And I'm very familiar with salary savings issues. I remember my chief of administration at the Board of Prison Terms coming in end of one year and saying, we've got all this money to spend. I said, how? Well, we have all these salary savings. I said, what from? And he told me, and I got a real education in salary savings. I said, no more salary savings with this organization. That's inculcated in all agency budgets, and that's an issue that we certainly should be considering in a long-range way, salary savings issues. That's not a good way to run government, I don't think. So I would support Senator DeCheney.
So you're willing to take it further than I am as well. Because this is the problem with doing something like a sweeping furlough. There are activities that we, save us money, like these appropriately do. And if you just simply say, I'm going to furlough everybody, then you have to come back and say, well, maybe it's not appropriate in certain areas. I would prefer to look at that than adding new positions at a time when we're furloughing people in this department for 2 days a month. It just doesn't make any sense to me, logically. And I don't think it actually saves us any money. And in fact, we're scoring this as an increase in cost, not a savings. So that's what disturbs me. And I know the vice chair is willing to and has made a motion, but personally, I'm not ready to support this right now.
I guess what I'm looking for is the savings. If in fact, Madam Chair, you could redirect 4 positions to do this and score the $35 million in savings,
I'm all
there.
for that.
Or the $66 million, but I think that included the ADHC. That's where, we got to move the ADHC thing to the side.
And we believe that the level of resources noted in your agenda is the level of resources that is required to also achieve the $67 million in local assistance savings that are also on the agenda.
Well, but I assume the LAO's $35 million is also local assistance savings, right?
Yes, it is. And 16 of the positions don't even achieve savings in the budget year. So that is a somewhat untrue statement.
But just redirecting the positions will take them off other fraud prevention work. We're just going to lose savings in other areas.
But what are they fraud preventing?
Well,
we may be eliminating whatever it is they're preventing fraud in. So maybe we could redirect them and not lay them off.
This proposal was to increase the intervention efforts. Based on the findings of the error rate study, there are new evolving patterns that we're detecting. And this was to add additional staff to do that. The existing problems that we see, we need to have staff that focus on areas related to data mining and continuing to focus on that, as well as to doing sweeps of different providers. This was adding new staff to take on these additional efforts. If we move the existing staff away, we're just going to put ourselves vulnerable in other places. We can't achieve the savings.
Well, you got 900. This says you got almost 1,000 positions between the Health Services and the Department of Justice.
Well,
you mean to tell me that, if people are coming up with new ways to defraud us, I can accept that notion. So why don't we use some of the folks that were pursuing the old ways people defraud us and move them to the people that are new ways of defrauding us? I don't know.
And that is the department's current practice. That is what they do right now, is redirect their staff to areas of new and emerging fraud. This is consistent with what they do, based on my discussions with them.
But do you believe they need 4 positions when they have 1,000 that they can't find?
I think for the provider report card, that is a new effort, and I think they probably do need new staff to focus on that.
All right. Well, we have a motion that was made by the vice chair that I'm not ready to support. What's your pleasure? You're up on it? So the Senate's there, the Assembly is not, unless the Republicans support the vice chair's motion? So it's 5-0 on the Assembly side and 2-3 on the Assembly side. The motion is to adopt the LAO alternative, which provides 4 new positions.
At $35 million, $36 million in savings.
Well, but does that turn that 2.899
Well, reduces it.
cost to a minus 35 million?
Well, it takes the 66 million
There's
savings
there's cost
becomes
in state
35 million.
There's cost in state operations. The LAO proposal would be lesser cost. The
Right.
savings are scored in the local assistance, but in order to get those local assistance savings, and in order to not have to backfill what we've proposed of 67, but I agree with the LAO that the ADHC issue should track with whatever we do on the ADHC. So if you want to score this $35 million in local assistance, then these are the resources needed in order
What's
to be
the
able to
cost
achieve
of the
them.
4 positions? It's not 2.8 million. So what is the cost of the 4 positions then?
It's probably 400,000 or 500,000, something like that. Yeah.
For 35 million, it's not a bad deal. But I do think they could find those positions. But I don't want finance going back and not scoring the savings. That's my concern. Is if they don't get the positions, finance won't score the 35 million, even though we all think they might be able to do that. I don't know how to resolve that contradiction.
Mr. Lowenthal, will you turn on your microphone?
So we're scoring a state support of about 400 to 500,000 and a local assistance savings of 35 million with this recommendation. Fine.
All right, if it's going to score that much savings, I'll go with it, and I think I've made my position abundantly clear about adding new positions when we're furloughing existing state employees. I just don't see that that's a good way to run our services, provide our services. All right, so that'll be recorded as a 5050 vote on the LAO's recommendation. So we'll go on to page 49. Additional Medi-Cal anti-fraud efforts in the IHSS program, and this is again an additional cost of $1.68 million. It's a conforming item with other items, so I think, members, we can skip this at this point. It's conforming to whatever actions we take in IHSS. Page 50, reversion language, assisted living waiver pilot. This is just correction for a technical error. Mr. Cheney moves adoption. A 5050 vote passes. The next items are vote only, starting on page 51, going through page 64. Any members wish to remove any of the vote-only items for discussion or a separate vote?
Yeah, I'd like to remove 57.
57,
We're not on?
And we're a no on 56.
and you're no on.
So this is for discussion? The breast cancer?
There are no on number 56. And then, did you want discussion, Mr. Dutton, on item 57?
Yeah, I like to have 57 pulled off.
All right, so that's for discussion. Any other items?
And they're no on this.
Yeah. Okay, so with the exceptions of items 56 and 57, the vote we will,
Just one technical.
go ahead, Mr. Cheney, and then I actually need a motion.
I just, I'll make the motion. I just want one technical clarification on 55. It's my understanding we can score some savings that aren't reflected in the, yeah, the Senate heard this in subcommittee, and the way we did our version of this, is that then you get this 500,000 in savings? Somebody?
Yes, Madam Chair. I believe you're using some special fund dollars to be able to avoid the loss of federal funds without incurring the general fund costs.
So what we want to do here is adopt, just so members are clear, is adopt the Senate version, it's not adopting the governor's proposal, it's adopting the Senate version is the motion on 55. And that scores, which doesn't kind of show here, say $500,000 in savings, that's all. Good. Okay, so with that clarification, I would move pages 51 through 55 and, separate 56 and 50.
58 through 63.
And 58 through 63, okay. We'll hold
All right,
56.
without objection, then, members, the vote will be recorded as 5050 on those items. And I think, did we already record the vote on item number 56?
No, we didn't.
Okay, that vote is 3232. Page 56. I understood you were a no on that one. All right. Then for discussion, item 57.
Yeah, and Madam Chair, the reason I wanted to pull this one is that we've had some issues before
58.
regarding overspending in this particular area. The budget includes $6.3 million for a current year deficiency. Okay, and normally you wouldn't do that during the budget process. It should be actually handled as a standalone bill that goes through the regular process. We've had some problem with this last year. It was the Baby Big program where there was actually a deficiency as well. And I've been told repeatedly that new administrative safeguards have been actually implemented, and so this type of thing wouldn't happen before. In fact, Mr. Kessler was actually just in my office last month, and we had a great deal of discussion about this type of thing. So I'm just concerned that here we go again with another situation, and so I'm going to have to vote. I won't support this because I just don't feel it's appropriate in the budget process. If they want to do a standalone deficiency bill, that's fine. We can discuss it under that venue, but I don't think it's appropriate now. And I'd also like to request that Dr. Horton and Mr. Kessler, maybe they can come and see me about this, because I thought we had this resolved.
Well, I guess Madam Chair.
Mr. Leno and then Mr. Cheney.
Just wanted to ask Finance, this 13.8 is for services that were provided in the current year.
It's, I believe it's, what's 6.3? Yes, Senator Leno. This is, as Senator Dutton mentioned, it's a deficiency associated with services that are being provided in the current year. It was the issue in the spending of deficiency rate was identified at a point in time where we did not have sufficient tools to be able to. It was too late in the year to be able to enact the contract changes and the changes in who we provide screens to in a manner that would avoid the deficiency. We are conducting an Office of State Audits and Evaluations review of the program come this September, and we appreciate that this is, as Senator Dutton mentioned, the type of thing that we need to make sure that does not occur. That said, we are in a situation where we're spending at a deficiency rate, and we have a challenge in the current year that we need to address, and we've identified some special funds to be able to do so.
Right, so these are non-general fund dollars.
Correct.
I would move the measure, but also I would like some more than reassurance, but certainty from you that we're not going to see this repeated again. But for now, we've incurred these expenses. We need to pay our bills. Non-general fund dollars, I would suggest we adopt it.
Mr. Cheney.
Yeah, well, that's the only thing. I mean, I don't know what we're doing to control the cost. Senator Dutton's point is right. And so is Senator Leonard. We do need to pay our bill. It's what it is. And fortunately, we found this other fund that's appropriate, although I note that it seems like the fund we could do 13 and we only need to pay 9. Is that, is there extra money here to use for something else? Or not?
Madam Chair, I guess one of my concerns here, I don't think it should be.
The going forward problem is.
But I don't think it should be buried in the budget, is what I'm saying. This is a deficiency bill that should be a standalone supplemental bill that we go through. That's my concern with it.
Right.
Is that it shouldn't be buried in the budget. That's all.
Is the Department of Public Health here to comment on that, on the issue of the legislation? So my understanding was that there was an attempt to do this, or consideration of it at least.
There was discussion of a potential of doing a current year standalone bill or doing language, and our judgment was that we would do language. We appreciate the concern, and that's part of the reason why we're moving forward with the audit to evaluate what's going on with the program, look at different alternatives for containing costs in the future, making sure that we have the mechanisms in effect to identify when we're spending it, when we're on track to spend at a deficiency rate earlier in the year. In terms of the questions about the different funds, there's two different components. One is the budget year component and what we anticipate would be going on with budget year cost and budget year caseload. The component that's associated with current year is 6.3. So there's two different pieces comprising the 13.8. Of that amount, only 6.3 is for the current year deficit problem.
And the rest is to the budget year, but are we reducing the size of the program or expecting controls to be in place? I mean, I understand Senator Dutton's point. It could have been a supplemental appropriations bill for the current year, but we're so far out of the current year, you might as well do it in the budget. It'll be the same thing. So I'm kind of not as hung up about that. But I am concerned that we not be looking at a deficiency every year.
Jacob Hoare, Department of Finance. That is correct. The department is going to take steps to some programmatic changes, including raising the age of eligibility. Currently, they serve women at the age of 40 and above. One of the ways they're proposing to control costs is to increase that to age 50. And then they're also going to, we're requesting that they provide quarterly fund conditions. We want to be able to work with them to monitor their expenditures over the next fiscal year.
All right. It's been moved to. I have a question, though, Ms. Matasantos. If this were a standalone piece of legislation, would it be a 2/3 vote or a majority vote? My understanding is it would be a 2/3 vote.
We need to double check the fund. It depends on whether it's a mixed fund or a true special fund. I believe it's a 2/3 vote, but we have to. Well, yeah, it would be an urgency measure too, so it would be a 2/3 vote.
Right.
One last comment. I'm sorry.
Yeah. Well, I just,
Mr. Dutton and then Mr. Leno.
just on that part, I guess my concern would be is that we have a procedure for handling deficiencies. And if we're going to start making exceptions, that's, I think, is part of the problem that we're starting to deal with now in a lot of different areas. So I'm uncomfortable with going forward on a, like I said, we have a procedure for handling it. We've had a problem in this particular area before. I don't know why it's such a big problem to do it as a standalone. I'm not saying there's probably anything wrong with the expenditure, maybe, but there is a problem. And I'm basically concerned about that, and I just don't know how else to deal with this because we've had this problem with them already before. There was assurances made that it was under control, and I just haven't. It just doesn't seem like that's the case, and to bury it in the budget just doesn't seem appropriate.
Yeah, I just don't know that standalone at this point helps. It's become out publicly. It's really so late in the current year that to do a supplemental appropriations bill is not going to happen sooner than this larger document. I mean, I guess I'm concerned about the process too, but I'm also on a technical basis. There's no way that current year bill happens before the end of the current year, separate from what's going on with the budget.
Mr. Leno, you were next on my list.
Thank you. I stand by my colleagues' comments. I also appreciate the respect for process that Senator Dutton is talking about. I would support the adoption of the measure, but I do want to suggest that before we automatically look at raising the age threshold, that I understand these are uninsured individuals who are getting this service. Could we look at some modest sliding scale? Because raising the age threshold would cause concern, I think, for many. If there's a way to find some money to be able to sustain the program, that might be a wise way to go.
It's a good idea.
All right, so we have a motion, members. All right, without objection, we'll record it as 3-2-3-2 on each side. All right, then that takes care of that vote only calendar. We can move on to page 64. And this is an LAO proposal, one-time elimination of support for the immunization assistance program for a savings of $18 million. LAO, would you like to start us off with a brief discussion, please? We've got a motion to adopt already.
Thank you, Madam Chair, members.
You know what? If there's no objection from either side, we'll just record a 5-0 vote on that item and move on. Yes, to support the LAO proposal. It is an LAO proposal. Page 65, proposed elimination of state support for domestic violence shelter program for a savings of $20.4 million. It's very problematic. Somebody like to start us off?
It's one of the difficult reductions that we have before you in light of our general fund situation and where it is that we have the ability to make general fund reductions. This would be a reduction in funding for shelter programs and shelter services. It's just the type of reduction that we believe our general fund condition requires, and it's a place where we where it's not a federally mandated program, and hence the reduction is before you.
What, I guess this is best directed to the LAO. What does this mean in terms of the direct services that would not be provided to these women and children that are primarily women and children who are victims of domestic violence?
This proposal would reduce services to victims of domestic violence. Services provided such as shelter, crisis hotlines, transitional housing, legal assistance, and emergency food and clothing would be reduced. We note that the elimination of general fund on individual shelters, it would be differential depending on their funding source. They have a variety of funding sources, usually including county general funds, foundation funding, or other private fundraising, federal grants, in addition to general funds. So it would depend on how heavily they relied on general fund, the impact on each individual shelter.
Mr. Cheney, then Mr. Nilo, then Mr. Blumenthal.
Well, this one is, what I was trying to get at is how much, we don't know what would be left in these programs. We know, that it would reduce services, but is this all of the general fund that's dedicated to this purpose?
This is all the general fund in the Department of Public Health. There's some special fund support for
I was
shelters.
going to say, is there any victims restitution money going to this program, or could that money go to this program?
We'll get back to you on that. This is a much larger amount of funding relative to the amount of funding that shelters received in the restitution fund side of the equation.
I'm sorry.
This is much larger than the level of funds that shelters receive from restitution funds. We can get back to you on fund balances on the restitution side and whether
I believe
there's
it's
any
about $250,000.
That's all. Oh,
it's a very small amount.
But
in
is there
comparison to
other
this.
money in there that could be redirected? I don't know how much could be redirected. I mean, this is just. It's a public safety issue. It's a family and children's issue. It's just something that we've given these grants. I mean, maybe we reduce the number. I don't know what that number could be. I don't think it's zeroing it out, which is what I understand this to be doing.
This eliminates the full amount of general fund support in the Department of Public Health for shelter-based services.
I don't know, 10%.
Mr. Nilo.
Thank you, Madam Chair. This is a perfect example of the many very difficult decisions that we're going to have to make. I think Ms. Montesantos stated it appropriately, referring to the challenged nature of the general fund. And from a personal perspective, I am a supporter of these efforts. We have an organization locally called WEAVE that probably many of you are familiar with because you live at least part-time here. And I have supported WEAVE personally in a significant way and would intend to continue to do so. But I still, and there is significant support for these efforts, as was indicated through foundation grants and individual donations. And I think this is a good example of a program that is likely not going to be decimated through the absence of state funding because of other areas of support. And so my point is, I support this effort. I do it with my own wallet, and yet I am compelled, given the budget, the situation of the budget in the state, to support the administration's proposal here.
Mr. Blumenfield, and then Mr. De Leon.
Well, most of my questions and sentiment have been already stated, but I'm curious about the, it says reduce services to 105,000 people. And I know you said it's a percentage of it, but what do we expect? Do we expect there to be other cost shifts with these folks if they're not getting the state service or the state grant, emergency rooms or others? Has that been factored in at all?
We haven't identified any cost shifts. I think what would likely happen is the shelters would just reduce certain services, and maybe those services would not be available or be available to a lesser extent.
The law enforcement and homeless shelters.
Yeah, I mean it may not be a scoreable cost shift, but I think we all know that there's going to be a real cost shift.
Yes, that's a potential.
Mr. De Leon, then Mr. Lowenthal, and then Ms. Walters.
Thank you, Madam Chair. I know it's difficult to sort of ascertain the way the pie is allocated with regards to these 501c3s in the community, how much they get from private sector foundation grants, how much they get from the feds, if they get any, how much they get from the county, and how much they get from us. So I know it's difficult for all of you to come up with those numbers, but this is a real tough one because this is elimination, at least the state's share of these resources, and this is not sort of a haircut. This is a decapitation, if you will. And I think perversely, as the economy continues to sour and go down, the demand for these types of services are just going to grow exponentially. And this is a tough one. I know that the example I just used with regards to as the economy goes down, certain services and demands are going to be needed even more so. We're going to use that example. I'll probably use that example for many other things as we go throughout this whole budget. But this is one issue, too, with regards to domestic violence against women and children that, Madam Chair, as well as colleagues, I know that everyone has to take a haircut or a buzz or a trim, if you will, but not a decapitation. And perhaps LAO and DOF can go back and sort of figure out, you know, if we squeeze the balloon and the bubble shows up somewhere else, where that bubble is going to be at. This is a tough one because I have family members who actually have been victims and who have utilized some of these services at a protection women's shelter. So if we can, and I don't know what that number is, because I know our vice chair sort of kind of grappled with what that number is. We don't have a magic formula, sliding scale that tells us automatically. And we got that software program. We throw in the numbers and we crunch something out, and it gives us a dollar figure, what that is in proportion to what the cut is. But this is something that I think we have to give very serious consideration and seeing, not eliminating this, but giving it a little slight cut.
Madam
Mr.
Chair,
Lowenthal, go ahead.
sorry, to your question of other fund sources, out of CalEMA, we provide $11.3 million. This year, we're proposing also to use about $2.1 million in additional federal funds to support shelter-based programs from the dollars that have become available through the Recovery Act.
That's good news. Mr. Lowenthal.
Yeah, well, that is the question. I'm trying to get my arms around the scope of this reduction. Does it mean, if we're reducing services to 105,000 persons, is that approximately how many persons use shelters per year? We're just going to reduce the services? Or are we saying we're going to reduce the population? It would come out to about 105,000. And this reduction in overall services, is there any way to quantify it? Is it a 50% reduction you're estimating that will have to be done, a 25%? I know it's hard because you don't know all the other funding sources, but for us to cut all the general fund versus 50% of the general fund, how much of a reduction are we talking about? And how do we make a decision about how much goes beyond a safety net?
And I think, Senator, as the LAO noted, the impact is going to depend on each shelter and what other sources they are receiving funding from and the relative role of these funds versus other funds. So this is one of a variety of fund sources that shelters receive. There's, as I've mentioned, the other funds from CalEMA. They also receive some local government funds, some funds from private donations and individuals, as well as some so they get an amalgamation of different fund sources, and the actual impact will depend on shelters, the extent to which they're able to secure additional funding from other sources, as well as the determinations that are made in each area. We can try to get you some more information about specifically what it will look like in different areas, but it will range based on other factors as well as individual decisions made at the shelter level.
Do you see potentially any shelters closing?
let's see what kind of specifics we can get back to you on. We definitely think that there would be an impact on services. The extent to which it would result in closures, let us get back to you on that point, please.
Ms. Walters, then Mr. Nielsen.
My question actually had to do with the federal fund grants available to replace these funds. And did I hear you accurately? And you said there was $2.1 million?
Correct.
Is there any additional funds, or that's it?
That's the amount that we've currently accessed on our dedicating for this purpose from the Recovery Act.
Okay.
Let me get back to you on whether there's any additional funds. I know these funds are already available and are already being made available for this purpose. And I think this is in the ballpark of how many funds we were able to access.
Okay.
But we'll get back to you if we have any additional ones.
Thank you.
Mr. Nielsen, and then Mr. Cheney.
It would appear that finance and analysts can maybe help us with some kind of a lesser figure than completely wiping it out. I come at this from the perspective of my many years chairing the Board of Prison Terms and seeing literally hundreds of thousands of cases, and knowing how those cases came to pass, and the methamphetamine, and et cetera, and the impact on the victims. So I'm very sensitive to this, but I'm also know that Assemblyman Nilo's observations are very on point. There is a lot of support in the community for these programs. And I would suggest that we do consider not completely wiping it out, but just maybe substantially reducing this amount, continuing some state general fund at some level, maybe half of what this is proposed of a cut, something, but that we at least maintain some general fund support.
Mr. Cheney.
Well, I'm back to where I was. I understand people are thinking about sending this over, but I was going to propose a 10% cut. That may not meet Mr. Nielsen's standard. I don't know how much to do. At least start there. If in the, I'm prepared to make that motion for a 10% cut. I think that's more or less backfilled with the federal. If we find additional information as you all come back, we can always reopen it later, but in the effort to try to move things along and not have them totally open, I'd do a 10% cut today.
Yeah. 10% is probably a little bit not enough for me, though. I think we need to recognize the fiscal imperative.
Once.
Need to
I
go
don't know. Let's see what you got.
I could go 50%.
Mr. Nilo.
I think it's important to realize that this is as Ms. Montesantos has said on at least a couple of occasions, this is only a portion of the funding for this effort. I don't know what the total funding is, but I doubt that this is the majority of it. There are lots of these efforts throughout the state. I don't know what the total amount of money that is spent between the grant funds, individual donations, et cetera, plus state funding, but and maybe that would be good to find that out, but this is likely a minor portion of the total amount of resources that are dedicated to these efforts. So this isn't going away because of this, number one. Number two, excuse me for sounding like a Republican, but government is not the only answer to the challenges that we have. And we create constituencies when times are good by spending more money, and then when times are difficult, those constituencies make our lives difficult in trying to cut things back. And perhaps this is just a micro example of that. And as I said, there is tremendous support in communities for these efforts, and the ability for organizations to raise funds in the community varies based upon their skills in that area, but put to the test, the skills can be quite effective, and the fundraising efforts also quite effective because it goes to a very welcome receptacle or receptor, if you will, for the request for funding. So to look at this, given the stress of the budget, as one that will decimate the program because of lack of alternatives, and therefore look at a reduction that is 10% relative to our overall problem is frankly meaningless. We might as well not do anything. And Mr. Nielsen had a an interesting proposal, given my position on it. I have a problem with that, but if we could move forward in that direction, it would be more significant relative to our budget problem, and recognize the reality that a lot of these community-based organizations are supported by the community, and they don't have to be supported by the state. And if the state cuts back, it doesn't mean it's the end of the world for them.
Mr. De Leon?
I was just going to say, I'd support Mr. Senator Nielsen's recommendation. Whatever cut we make, and the difference, if Mr. Neela would make up the difference out of his own pocket, I'd go with that right there. Since you have a historic track record of contributing to these CBOs, I'd go with that right there. But I just want to add one thing. As I do come from as a former community organizer with a nonprofit agency, it is tough. The economy, obviously, is taking a toll on everybody, and even giving to 501c3s from foundations, from individuals who have, personal wealth, it's become very, very difficult. And a lot of these community-based organizations obviously are located in certain areas throughout the state of California, where the vast majority of folks obviously are folks of low-income means. Obviously, it's just difficult. It's tough for them too. So, the free market left to its own devices, obviously in a very good, strong economic year. These community-based organizations could maybe fend for themselves, and even then it's still tough for them. But in an economic year like this, we are the only safety net for these battered women.
Mr. Cheney, I believe you have a compromise to suggest.
Yeah, one more time with feeling. Just to make the points, though, our notes indicate this would reduce services to 105,000 people. That's real. I agree with Mr. De Leon a little bit. Every nonprofit I know in my district is screaming that they're having trouble raising money, and and there's a whole myriad of things that we've proposed here where we're asking people to donate where they shouldn't have, whether it's in poison control, or it's going to be in healthy families, or it's going to be in clinics, or we're going to be asking a lot of donations for a lot of folks here. And I would point out to folks that this dollar amount here is the same amount it's been since 2005 at least. It's not like this has been increasing. We've just been flat doing these grants, and so I think a lot of folks have come to rely on that piece of their funding, and it hasn't increased in the last 5 years. So one last try, compromise with Mr. Nielsen, 20% reduction, acknowledging the federal funds that may replace some of that.
Senator Cheney, could we then offer, though, that this item could be revisited? We've got a lot of budget stuff ahead. I could support that, but with the assumption that I don't think it maybe is enough, and we may have to go back and take another bite here. Let's just flag that.
And if all the other information folks have comes back and it looks more viable, that's fine. So 20% reduction.
Good.
And I'm seeing shakes of the head on my left, and a nod and a shake on the right. So without objection, then the Assembly will record a 4-1 vote to pass, and the Senate will record a 3-2 vote to pass.
Good.
All right, then item number 66, proposed elimination of maternal, child, and adolescent health programs for a savings of $16.7 million. Leo, there's 4 different programs, I think, or 5 different programs here that get proposed for elimination. Could you identify just briefly the difference between the programs for us?
Sure. This is an administration proposal to eliminate the general fund support for programs in the maternal, child, and adolescent health area. The largest reduction is about $10.8 million in the Adolescent Family Life Program. This provides case management services for pregnant and parenting teens. There are additional cuts in the Birth Defects Monitoring Program, which gathers data on birth defects. There's a reduction proposed in the Black Infant Health Program, and a variety of local grants that go out to mostly county health departments to improve maternal, child, and adolescent health at the local level. I would note that the administration proposal removes all general fund for these programs. These programs, and correct me if I'm wrong, these programs will all be preserved, albeit at a lower level. They do have Title V funds, so these programs will be operating at a lower level with the general fund removed.
I mean, I guess our only question, I understand we're going to do some of this, but given these programs, I have two questions. One is, on the Adolescent Family Life Program, how does that interrelate with in the 98 number, the CalSafe program? I mean, are these doing the same services? And it's one that we've had some concern about. We had testimony about. It serves pregnant teens. It's $98. It's a categorical. It had been lumped into the flexibility item, which has been a cause of some concern to some of us that some school districts are no longer offering it. It's pregnant teens. I don't know what this program does. It's different than what that program does. They sound sort of similar to me. But I think it's an important group to focus on for some of the same reasons Mr. Nielsen just articulated about domestic violence and long-term costs in prisons and such. So, and I understand there are federal funds, but I don't know how they divide up. So our thought, members, was just maybe to leave it open just quickly to get sort of some sense of how to come back with a package that acknowledges the federal funds with whatever the appropriate reduction might be. I don't know that this is the number or not the number, depending on how that sorts out. I mean, so Mr. Bloomfield?
Yeah, just along the same lines, and it's the same question I've had for all of these. I'm trying to gauge the percentage. It's hard to make these choices without having a sense of how much of our state money do these programs depend on. What is the percentage of the eliminated funds versus the entire budget of these different programs?
It depends on which program. For the Adolescent Family Life Program, the total budget in 8-9 in current year is $27 million, and the total budget would be $12 million.
Cut from 27 to 12 is what?
Right. So that would be a $10.8 million general fund cut, and the rest, about $3 million, would be federal funds that we'd lose as a result of a loss of match.
Okay. And what about the other ones?
The Black Infant Health Program would be reduced approximately in half, from about $13 million to $6.8 million total funds, based on a $3.9 million general fund reduction.
So we're cutting 3.9, but it's resulting in a 50% cut with a total of 13 million. Okay. And the birth defects monitoring program?
Birth defects monitoring program would still have $1.2 million in federal funds, and as LAO stated, this funding is related to the birth defects monitoring registry and the collection of data in several counties within the state.
Before we go to Mr. Dutton, I want to note for the public that the television screen reflects the wrong item. We're actually on item 4265, Department of Public Health. Mr. Dutton?
Yeah, just curious about, is there, when you're, I'm assuming you say you're going to bring this back, is that what I understand?
We haven't made a decision.
Oh, okay. Well then, I'm curious, aren't there grants from some private health foundations and things that can also be accessed for these programs? A variety of them at all? Also, what about First Five? Can First Five, is that allowable?
I think for some of these activities, they would be appropriate for First Five in terms of, for example, Black Infant Health Program works with to try to reduce it focuses on kind of prenatal services and services for moms. There may be some federal funds, some First Five funds that may be appropriate for some of these programs. In terms of other foundation support, there could be foundation support for some of these programs as well.
Okay. I was curious, too. I know, like March of Dimes, participate with that every year. They do a lot with birth defects and so forth. Are they a partner with us on these programs, or?
Not on this particular program.
They're the contractor. Are they? Okay. Okay, thank you.
Members, unless there's an objection, what I'd like to do is have the LAO and the Department of Finance bring this back after we've and the staff work together and sort out the different funding sources before we take action on this. So it will come back to us.
Keep it open.
Page 67 suspends Children's Dental Disease Prevention Program for a savings of $2.9 million. I have a motion to adopt. Without objection, then, we will accept this recommendation on 5-0 vote. Page 68, eliminate Proposition 99 funds for county health services. This is scored elsewhere, I believe.
Sorry, Madam Chair. This is proposed reductions in Prop 99 funds that in turn are directed to achieve savings in the Medi-Cal program. So this scores the Prop 99 change. The general fund impact is a Medi-Cal impact.
Yeah, I guess we can do it, but is this the same rural health services, the same rural clinics that we just talked about in the other? No, it's different.
These are two programs that provide funding to local health departments and for county indigent health programs. So there's one that is the CHIS program, and then the rural health services focuses on rural counties. So it's different from the clinic program.
But the emergency physician, so we're taking money from the emergency physicians and those and then just putting it into the general Medi-Cal where all these same providers will get it in some fashion or t'other?
Yeah,
hospital outpatient, that's what we're sending in?
These funds are the ones that augment the MADI funds, yeah.
Orthopedic hospital settlement? Oh.
Yeah, the funds augment either the MADI funds that provide funding for uncompensated care. There's also funding for county services to county indigent populations. We're proposing those reductions to in turn shift those funds into the Medi-Cal program through the orthopedic settlement account. So there's different 99 programs that we're proposing reductions in order to capture savings in the Medi-Cal program.
But I'm just, so they'll be going into the Medi-Cal program where essentially those same emergency physician providers can access them as when they serve Medi-Cal patients, right? Or not?
It's these are dollars for uncompensated costs. So these are generally funds for otherwise uncompensated care, but it generally from a provider category, it's similar providers who are seeing uninsured as providers who are seeing Medi-Cal populations.
Still going into but it'll be going into Medi-Cal providers so that we can try to keep that program.
Yeah, savings in the Medi-Cal program, correct.
I'm ready to approve this item.
Just one question
go ahead, Mr. Leno.
Before we adopt. Just wanted to see if Finance or LAO could just give us a little history. How have we clipped emergency room physicians in recent years?
We haven't.
I don't have any exact numbers, but overall, Proposition 99 revenues have declined. The trend has been downward over the past several years. So funding in this area has generally come down.
Okay, I realize where we may have to go, but I do want to point out that not only in rural areas, but also in my urban district, there are very few hospitals with remaining emergency rooms, and it puts everybody yet at risk further.
Just a quick comment.
Mr. Blumenfield?
Yeah, no, I mean, I feel the same way. I know where we have to go on some of this, but I mean, all of the cuts that we're making everywhere else is just pushing the problem down and to the emergency structure, and I'm just worried that we're at the breaking point with our emergency rooms. We already are, and you know, we need to figure out, if not through this budget item, but we need to figure out a way to provide some extra support for emergency rooms and our emergency room physicians, because we are just putting an enormous amount of pressure on them with this budgeting.
Well, hopefully the theory would be that the savings from this could be used in Medi-Cal to keep the Medi-Cal program in some fashion that would stop everybody from going to the emergency room. I mean, that's it's sort of one of these. You're right. It's push-pull somewhere. So it's using $99 in a way that keeps Medi-Cal whole, which draws down additional federal funds. This way, they're uncompensated care. They don't draw down federal funds. Move it to Medi-Cal, they do. So reluctant move adoption.
All right, we have a regretful motion to adopt. Without objection, we'll record the vote as 5-0 on the Senate side. We have one absent member on the Assembly side, so it's 4-0 at this point, and Mr. DeLeon will add on. Page 69, reduce Proposition 99 funds for the asthma program, and also an LAO proposal to eliminate the general fund support for Alzheimer's research centers. I like to take them separately. There's no budget savings scored for reducing Proposition 99 funds for the asthma program. at least not on my agenda.
The general fund savings, again, come in the Medi-Cal item, so it's savings made in 99 to reduce general fund costs in Medi-Cal. This is a fairly recent program, and this is a reduction in the funding to the asthma program rather than an elimination. This program, I believe, was created in
What kind of services does the program provide, though?
It's a public health program that.
It's not that. All my kids do.
Yeah.
The program provides funding for 10 community health center programs that are located throughout the state. Again, I believe this program is fairly recent. I don't have a year on me, but we can get that.
This program was funded when we did a restructuring of Proposition 99 to be able to access additional federal funds. It generated a variety of savings within Prop 99. We directed a portion of those funds to support an asthma program that had been defunded from, I believe, first 5 resources. We basically said, let's first 5 stop funding that program. We had savings in 99. We started funding it out of Prop 99. We now don't have the Prop 99 resources to fund it at that level. We are maintaining the program, just not at the full level that was funded in, I believe, 5-6.
All right, we have a motion for adoption. Without objection, then, the vote will be 5-0 on the Senate side and again 4-0 on the Assembly side. Let's move to the elimination of general fund support for Alzheimer's Research Center, also on page 69, an LAO proposal to save $6.2 million. Now, even though these centers are called research centers, my understanding is they do provide direct care, and we heard a number of people come to our committee a couple weeks ago and testify about the services that were provided here. Well, I guess you're talking, your proposal, LAO, is to eliminate all of the general fund funding, and does that eliminate all of the programs then, or all of the centers?
The general fund funds a portion of the total centers. Again, we don't have all of the budgets of the 10 different centers. It's possible that some would close. It's possible that others would reduce or eliminate certain services. I'd like to note that we present this as an option. You know, we're not recommending this on a policy basis. This is an option for general fund savings.
So, are these centers all at UCs?
There are 7 at UCs.
7 out of 10 are at UCs. And are we paying some portion of the UC overhead? I mean, how much of what the state is funding goes to administration?
We are. I believe it's 8% that goes to UC overhead.
Or 8?
8.
8, okay. And then the other question I have is, have you looked at any other alternatives, such as whether or not any the folks served in the centers might have insurance coverage available, and whether or not we might consider a fee-for-service?
Right. The centers do accept insurance, but they accept all patients regardless of insurance status. They accept Medicare, Medi-Cal, private insurance. Some of them have federal research grants. So they do bring in other sources of funding, and for a portion of the services that they provide, they are reimbursable by the various insurance that they accept. Some of the services are not reimbursable. Obviously, the clinical research, some of the training, kind of case management, caregiver training type services are not reimbursed by insurance, but the direct diagnostic services are generally reimbursed by insurance if the patient has insurance.
Mr. Dutton, did you have a question?
Yeah, just real quick, you made the reference that, you know, it's possible some centers would close. Is it also possible that centers won't close?
Certainly, I think if alternative funding, if they were able to locate alternative funding sources,
Right.
for example, general university research funding or other funding sources, foundation funding, if they were able to locate alternative funding sources to backfill the general
Well, I just
fund
wanted to
reduction.
clarify. We don't know for a fact they would close because we haven't really talked to any of them. We don't know what their personal thing is. So making the assumption, you know, I could also equally assume that they would continue to operate in some capacity or something.
The centers, several of them do say they would close
Okay.
if general fund was not available.
All right. Thank you.
I would imagine that if they were able to locate alternative funding to backfill that, then they wouldn't.
All right, thank you.
Mr. Leno, Mr. Lowenthal, and then Mr. De Leon.
Thank you, Madam Chair. So just wanted to underscore that this program does provide assistance to family caregivers and to support groups and such. So I realize we may have to take some cut here. I would argue against the entirety only because the same population is likely to suffer significantly with regard to actions we'll take with adult day health care centers, with SSI, SSP in some cases, as well as with IHSS. So not only out of concern for those who currently are suffering from this devastating disease, but also with recognition that we're dissembling an infrastructure that we're going to need in the years to come, because this is a huge epidemic that is going to slam the state of California. Projections of 500,000 Californians growing to 1.5 million Californians by 2020. And it, to the degree that we can keep the village intact, because families can't sustain themselves on their own. They need outside help. We need community-based support. So I just suggest we want to proceed cautiously.
We would agree that it's not an all or nothing proposal. And we would also note that approximately $1 million is in data and evaluation and research grants. And that's separate from the kind of general direct services that provide core support for the centers. So there's about $1 million in data evaluation and pure research grants, which is sometimes integrated with the clinical care, but those are for research grants. There's $5.2 million that provide the core support for the centers, and each center receives approximately $520,000.
Well, I have Mr. Lowenthal and then Mr. De Leon, and then Mr. Cheney.
I'm glad. That actually was my question. What percentage is in research and how much is in either training of professionals or direct services? And if we eliminated, let's say, the research part, would UC still want to continue this? Or would this, or is that the driving force, the research, or the $1 million in grants for UC? Or is it, would they still continue these centers if we said, let's provide the direct care or some of that, but not the research? Do we have any idea with 70% being on UC campuses?
You know, I can't really say. It would be up to each individual university, and of course they could also choose to backfill. Say if funding were lost, they could choose to backfill research funding. Some of them also have, National Institutes of Health, for example, federal grants to do research. So,
Mr. De Leon, then Mr. Cheney.
Thank you very much, Madam Chair. I know this is LA's recommendation. I'm a little tardy to this discussion. The $6.2 million recommendation that you have before us, this is our total funding from the general fund to these Alzheimer's research centers?
That's correct.
So it's not a portion, or
It's not a portion.
this is the complete, right?
This proposal, this option
State. That's what I'm referring to.
is
right?
for
Okay.
the elimination of state general funds.
And the $6.2 million general fund funding for these Alzheimer's research centers, do they complement matching funds that we get at the federal level? And again, I apologize, I'm just a little tardy to this conversation.
Sure. Some of the centers, because they have this core funding, are able to draw down, not a federal match, but federal research money. Federal research grants.
From NIH?
Yeah.
If we cut or cut too deep into this general fund funding, will it jeopardize that federal dollars? Or could it jeopardize the federal dollars?
Certainly, it could, yes.
Okay. And again, so because I grappled with this the other day for my own education, this is not precisely direct services, but rather this is, if I have a family member who has Alzheimer's, I suspect he or she has Alzheimer's, and my general practitioner is not able to figure it out, I'm recommended to go to one of these facilities, and these facilities will help me, figure out the whole complex dilemma that's Alzheimer's,
Right. They provide diagnostic services and a variety of support services.
Okay. Madam Chair, I would just say, Madam Chair, as well as colleagues, similar to the domestic violence item that we dealt with a few minutes ago, I'm not prepared to eliminate complete funding from the general fund for these folks. But again, if it has to take a haircut, then so be it, but not the complete elimination.
Mr. Cheney, then Mr. Nilo. Mr. Nilo, then Mr. Cheney. I believe we have a motion once you're done.
Okay. That's Ms. Ducheney will have a motion. For either party down there, has there been augmentations in this fund recently? And if so, how much and when?
There has been a recent augmentation. We're verifying to make sure the amount. I believe it was around 3 or 4. 2. Okay, 2, and it was in 6-7.
5, 6, 6, 7. Yeah.
It was $2 million.
$2 million augmentation to the base program, and it was done in 2006-7. Is my recollection.
Thank you.
Mr. Cheney.
That leads in nicely. I mean, I do think these folks, there's new federal NIH money. There may be some grants for this. They're going to have to figure it out. And the suggestion we had was maybe acknowledging the $2 million augmentation is take that 50% cut would be leaving $3 million in the program. I don't know. I mean, and maybe perhaps some language stipulating it's not to go into the research grants. It has to go into the case management stuff. Let them go apply to the feds for the research grant. Whatever that piece was, you said data and local, that piece, that $1 million piece, they have to go get that somewhere else. And this $3 million is focused on the other things, the counseling, the caregiving, the workforce stuff, the treatments, clinical treatments if necessary. It'd be 50% cut. I don't know if that goes anywhere.
The motion is for a 50% cut, not to eliminate the entire general fund.
And budget language that stipulates that the money that's left from the general fund not be used for the data collection research piece.
To the motion, Madam Chair, this is very much like the effort to assist battered women, as we discussed a little bit ago. Their funding is significantly more than that which the state provides. And I spoke previously to community support for community-based organizations. I understand the point of Mr. De Leon and others that in current economic situations, fundraising is more difficult. It is still done, and it is still done successfully. More difficult, yes. But I would point out that the state's general fund, that which we are dealing with now for the budget year, is about 25% less than would it been prior to the economic collapse. That's kind of a big deal. 50% is a big deal too, but unemployment and personal income have not dropped by 25%, or employment and personal income have not dropped by 25%. A case could be made that the private sector might be better able to afford this assistance than the state can now, with the depth of the drop that we have in our general fund resources. And if we keep on attacking each of these spending reductions in this fashion, fellow members of the conference committee, we are never going to get where we need to be by the middle of this month.
Mr. Leno, I would just note, though, this was not the governor's proposal. This is a new proposal from the LAO, so it wasn't in the May revise. Mr. Leno?
That was half of my comment, and the other half was if we are looking at a 27% drop in general fund revenue this year, to cut a program by 50% support is twice that. So I think this is a good compromise.
All right, then,
Come up with the alternative now. Let's not say we're going to come up with
But
alternative.
it wasn't part of the
and
May
then
revision to
revisit.
begin
well,
with.
wait. We can't come up with alternatives now. We have to go item by item through the entire May revise, and it's going to require us to work through Friday at least to do that. So as nice as it would be to be able to say, we'll cut here and restore there, and offset it, we simply can't do that by virtue of how the budget is laid out. And we will, at the end of this process, have one big package. So let's keep moving with that goal in mind. We have a motion, and we have a 3-2 vote on the Assembly side, and we have Mr. Dutton is an aye, so we have a 5-0 on the Senate side. All right, moving on to page 70. Pages 70 through 74 are all AIDS programs. So I would assume they're different funding sources, but somehow related. So anyway, just would point out that we have 4 pages devoted to these programs. The first one is AIDS Drug Assistance Program, ADAP, for a savings of $12.3 million.
Madam Chair, would
Yes.
you like me to discuss the entirety of the AIDS programs as a package?
Well, I guess
as
it
the
depends on the
proposals?
funding source, and because I think they're all different programs. So why don't we take it one by one?
Okay. The administration proposes to reduce the AIDS Drug Assistance Program by $12.3 million. This was also an LAO proposal in our May revise. A $10 million reduction to the ADAP formulary. This would be decided in consultation with the Medical Advisory Committee with ADAP. And there's also a proposal to add premiums to the ADAP program for those making over 200% of federal poverty level.
Department of Finance, did you have a comment? I have a question that I hope can be answered fairly quickly, but go ahead.
No comment. Happy to answer your questions.
Okay. Our notes say that the May revision estimated a reserve of $47.7 million for 2009-2010 in the ADAP budget. And if we're talking about cutting $12.3 million, that seems like a pretty healthy reserve. I'm wondering what the reserves are for, how much is a healthy reserve, what's the entire program, what's the percentage, what percentage is $47.7 million of the entire program?
I would just, regarding the reserve, I would just point out that of the $47 million reserve, approximately $24 million is as a result of one-time adjustments that, in other words, there were some one-time expenditure and revenue adjustments, and so a large portion of that reserve, is already, it's not going to carry over to the following year. It does reflect one-time issues. As far as an appropriate reserve, this program generally, historically, expenditures have been increasing, and there are the rebate fund, the general fund, and essentially federal funds have been basically fixed in this program at a flat level. The rebate fund has been used to manage the increases and decreases throughout the year in expenditure levels. So the program operates very efficiently. The invoices are from the pharmacy benefit manager, which are received by the program, are generally turned around. Payment is made within 2 or 3 weeks, I believe. So they generally like to have there should be a large cash reserve in order to manage expenditures and revenues coming in and going out over the period of the fiscal year.
So is this a $47.7 million cash on hand, or is it a budgetary reserve at the end of each fiscal year?
It's the estimated budget reserve at the end of 9/10, at the end of 2009-10.
Okay. Mr. Leno?
Thank you, Madam Chair. Some questions for the LAO. If we were to, there's an issue of maintenance of effort here, right, in the totality of our proposed cuts by the governor with regards to HIV/AIDS.
Yes.
Can you give us certainty that we would meet the maintenance of effort in 10 and 11 if we do take these cuts? And I think the federal money, this is the Ryan White money, that would be put at risk is in the neighborhood of $128 million.
Right. This raises a larger issue of the maintenance of effort requirement. Basically, the state must spend at least the same amount on services to HIV/AIDS individuals as they did the prior year. And spending on a variety of programs is counted towards MOE. Because of the increase in the FMAP that we've received through ARA, we've actually reduced our spending within the Medi-Cal program on HIV/AIDS by approximately $75 million. So that, even without these reductions, that impacts our ability to meet MOE. We are recommending that the administration pursue flexibility from the feds and through our congressional delegation on either counting other funding sources such as the rebate fund towards MOE or flexibility with meeting MOE.
Finance, please.
We're in discussions with HRSA, and verbally they've agreed that rebate funds would count towards state support for purposes of the Ryan White maintenance of effort.
That is confirmed?
We are waiting for the written confirmation. We have gotten verbal confirmation that that is the case. With that clarification from the federal government, we think we can meet the maintenance of effort level.
Okay, well, that's a good piece of news if we can confirm that. But then back to LAO. And/or finance, the proposed $10 million reduction in formulary drugs. Can you walk us through that? What are the assumptions? Is this deleting drugs or using more generics, or how are we going to do this?
We'd work with the clinical advisory committee to identify which drugs to remove from the formulary. We would protect the antiretroviral drugs, so we would be looking at drugs that treat side effects associated with antiretroviral drugs. So, for example, maybe it impact anti-wasting drugs, or maybe it would be drugs that deal with nausea or other side effects associated with the drug. So we would try to protect the core antiretroviral drugs. We would work with the advisory committee, and depending on the advice of the clinical committee and the decisions by the ADAP program, that would affect the specific drugs that would not be included in the formulary going forward.
Okay. And then I want to ask a few questions about the premiums as well. But I just want to remind my colleagues that, and please correct me if my numbers are off, annual costs for the drugs that those in the program are in daily need of can amount to about $15,000, $20,000 a year?
That sounds consistent with
Right.
my understanding.
So this is a major sustaining factor for upwards of 35,000 lives as we speak. And additionally, that ADAP is the payer of last resort. So this is the last of the last of the last of the net that keeps people alive. They've got no place else to turn. So with regard to the premiums, you've got this 2.2% increase premium for those who are earning up to 300% of federal poverty. So that's around $25,000 a year. Works out to about $46 a month. Reason I spell all this out is how many of these folks, because these are the most vulnerable, are at risk of losing some of their SSI, SSP, depending upon decisions we make?
If they're above 200% of poverty, that's generally going to be above the level that SSI reaches into. So we're probably going to be talking about low-income people whose income is above the SSI level. SSI generally is in between 100 and 133% of income.
Okay.
It does depend on the type of income they have, though.
And just underscoring your point, at much lower level of income, they're probably not in ADAP, they're in Medi-Cal?
Correct. As you mentioned, this is a payer of last resort, so we provide similar services to medically eligible to populations eligible for the Medi-Cal program. SSI individuals or individuals receiving on SSI are automatically eligible for Medi-Cal, so they'd be receiving these services through the Medi-Cal program.
And then of course, going up to 400% and up to 50,000, it gets even less so, of course.
And the other thing is that, as you mentioned, ADAP is a payer of last resort. So there are some individuals who are on ADAP who have private coverage and where ADAP plays the role of providing more of a wraparound coverage versus being the payer of first resort. And that's going to be more so as we go up the income scale.
And if we do have to go down the path out of necessity of premium, who collects it? How does all that work?
The Office of AIDS currently has a pharmacy benefit manager. It's a contract. The program would be administered through the PBM.
Can you repeat that last point?
Pharmacy. The pharmacy benefit manager. That is the ADAP program is administered through a contract with the pharmacy benefit manager. It is the sole contractor or the sole administrator of the program.
So the premium is paid to that entity.
My understanding is a premium, they would collect the premiums. Those premiums would then be used. They would go into the rebate fund, flow into the ADAP rebate fund, which would then be used as part, towards the expenditures in the program.
I think the Dems are going to go with this.
And are there administrative costs that would be associated?
There would be administrative costs out of the savings for 2009-10 are approximately $2.3 million. That's assuming a January implementation. And the admin costs are approximately $320,000. That's what the estimate is at this time.
Okay. Thank you.
Mr. Nielsen?
Well, it would seem like there might be some room for compromise in working on the formulary and the premium. And the other side of this is that that reserve is very significant. And the state would like to have that kind of reserve right now. We don't. And to say that you protect it because that helps pay, that's great. We really like that. But for at least this year, I think we don't have that luxury. So I would say that that is something that we would just have to say that you're going to fund it out of the reserves. Was that compromise service in any way?
The question in some ways might be, first, what's the potential general fund exposure to the extent that a portion of the reserve is one-time funds and we don't know if they're going to be consistent. The other question is what happens in the service delivery later in the year if it turns out that our expenditures are projected at a higher level than assumed in the budget. If we don't have the reserve to cover those costs, then there would be program impact. Or general fund exposure, one or the other.
And I think we understand that. We're dealing with the deck we're dealt today, though, not later on in the year.
Additionally, Jesse McGlynn, Department of Finance, the way the rebate fund works is it would spiral down because you only get about half back when you use those as for the funding of the program. The rebates only generate about 50% back in rebates. So essentially the program would spiral down if it's fully dependent on the rebate fund as it stands now.
I do understand that, but our state budget is spiraling down, too. I mean, that's a fundamental hard reckoning, and maybe there would be some discussion as far as the formulary. Is there some kind of way we could, and the premiums, that we could reach some kind of a compromise on that would be some long-term savings, because that's another part of this that I think is important. Let's have some discussion on that as members of the committee.
Mr. Cheney?
Well, I was going to suggest the same thing. I think staff, clearly there's some mixed messages going on here, and they relate to some of the other programs down the road here. I think the direction to staff, LAO, finance, go figure this out. I think we're somewhere. I think some of these things can be done. We do want to long-term stabilize, but we don't want to endanger the $128 million in Ryan White funds. So whatever it is we do to maintain the maintenance of effort and protect the Ryan White, get all we can from the rebate programs, and to the extent we can utilize this reserve, we ought to. I mean, he's right. Controller Chung would love to have a reserve of $47 million today. He doesn't. So, we got to find, or proportional at least to the program, that amount. I mean, we just need to figure out how to do this. It sounds like all of you have an idea, but we've got to tighten this up. I think a staff, all of the staff in LAO and finance should be able to find a compromise on this one that makes sense. Yep. And some trailer bill language to make sure we've done what we need to do. But we need to protect that be sort of the baseline is protect the federal funding, and do what we can to protect as many people as we can. This is, as Mr. Leno points out, one of the most cost-effective programs we run in the whole state. Goes back to some of the earlier discussions. Why would we destroy the ones that work? We can keep trying to find the ones that don't, but this one saves not only money but lives at a rather impressive rate. So.
Mr. Dutton.
Yeah, on this particular program, I'm kind of working under the impression that what we're trying to do here also is to take a program that's seen some pretty significant growth and to try to put in some additional controls and things like that so it doesn't get out of hand. Actually trying to be a little bit proactive, I think, almost in trying to make sure it's being used. And this doesn't really, these actions aren't really going to take anybody out of the program, right?
Correct. These are a change in the benefit and the number of drugs that we would cover, as well as increased cost sharing for those who are relatively higher income relative to program eligibles.
Yeah, so those people that have a higher income, they're going to have to pay a little bit more, but they can afford to do that, right? Okay.
We know that we are very supportive of this proposal as a long-term cost savings measure in this program. This program has been growing very quickly. And as Ms. Matasandos mentioned, the rebate fund is not a sustainable funding source for the program.
Right. Yeah, I think this gives us an opportunity to, get it under control before it gets out of control, and it doesn't displace anybody. So we'd be supportive, but whatever the chair would like to do.
Well, what I did want to point out is I think the committee is building a consensus that we are willing to take a cut to the program, but we do want to have the issues answered with respect to the MOE, the Ryan White funds, and the other things that Ms. Ducheney laid out, and have that more specific proposal brought back to us before we take action. Mr. Leno.
Just one last comment with regard to the growth in the program. It's fairly stable, 35,000 over the years. It doesn't really go beyond that. Costs increase are because of the cost of the pharmaceuticals. It's not because a lot of people are jumping on board. Yeah.
All right. Is that all the discussion on this particular item? All right, we can move on to page 71. The first item on page 71 is Office of AIDS Therapeutic Monitoring Program for a savings of $8 million. Is there discussion on this item, members? The recommendation is to hold this open as well as some of the other items so we can deal with this whole thing as a package.
Yeah, I think the rebates and the Ryan White all interact in all these things, so we would suggest, that's why I think Senator Dutt leaving the first one open allows you to maneuver with all of them to get whatever that number is that is the most protective of human life and meets the MOE requirements and, and what that combination of prevention and pushing on rebates is. I don't know. Mr. Leno knows more about that.
All right. So, yes, Mr. Leno.
Could we ask LAO just to better inform us how this works and how it works in tandem with ADAP, the therapeutic
monitoring program?
Yes.
This program allows physicians to test and to optimize treatment for patients undergoing HIV/AIDS treatment. So to the extent that they can provide more appropriate pharmaceutical care to a patient, this would assist them in optimizing the actual drug combinations.
And is rebate reserve appropriate consideration for this without risking ADAP?
In general, we're not supportive of further drawing down that rebate fund for the reasons we mentioned. In terms of whether or not this is an acceptable use of ADAP rebate funds?
You have a variety of different fund sources, and basically, for example, you could increase how much rebate funds if there's determined that the program can support a use for ADAP, which in turn frees up general fund that you can use here. So there's different programs all funded with the same combination of fund sources, and there's an opportunity to move some dollars around. The constraint is really what are assumptions do we make about how much of those funds are ongoing and whether or not what is a reserve that we can maintain the current level of services. But you can definitely look at how to finance programs in a way that provides general fund for other programs that are not funded in the core ADAP.
Okay. And with regard to this therapeutic monitoring, which sounds like a rather technical term, the drug therapies are sometimes art as much as science, and to get the right drugs actually could save us money, can save lives, can save expenses in the emergency room and with regard to reactions to combination therapies. So this is more than just frosting on the cake.
Right. I don't have any data on the actual cost effectiveness of this program, but to the extent that this provides more appropriate treatment, that's true.
Okay, thank you.
All right, so, yeah, I'm hearing the vice chair saying she wants a package so we can take one action on all of this, and I think that makes sense because it's all interrelated. So unless there's an objection, we can hold open the items on page 71.
Madam Chair,
And then-
can I-
yes.
just one quick question. So we're going to ask LAO and DOF to put a whole package together?
Yeah, there's one more page that we need to look at.
Because-
that-
We're asking our staffs to do
Right.
that.
Gotcha. All
Yeah,
right,
the
that's fine.
staff, the LAO, and the Department of Finance. But it should all come back to us so we can take one action with the guidance that was stated a little earlier. On page 72, it's the Office of AIDS Local Assistance Programs for savings of $31.7 million. Same, I believe we should give the same guidance, if that's all right with members. It should all come back as one package, one action. Mr.
I
Leno?
agree, and if we could get some information so that we can be able to finesse that package fully informed. Keep in mind, we're talking about a communicable disease which was once a raging epidemic in California. We have successfully contained it, and with the assistance of the drug formularies, made what was once a death sentence into a chronic disease. So we've had a lot of success with the expenditures of these dollars. Do we know how many seroconversions from negative to positive California experiences each year? I know in San Francisco it's about 1,000 a month. It doesn't go up, it doesn't go down, so we consider it now endemic as opposed to epidemic. What about statewide?
New HIV infections?
Yes.
It's approximately 5,000 to 6,000
5,000 to 6,000
per year.
And could you get us information? How does that compare to 5, 10, 15 years ago? Because I think it was astronomically higher.
Certainly.
And the reason I ask that question is the last thing we want to see is those numbers go up exponentially again, because it's going to be an uncontrollable epidemic again. And if we were to eliminate the Office of AIDS, I'd be curious to know what the rate increase the administration projects. So if we're living with 5,000, 6,000 new HIV infections now, if we no longer have an Office of AIDS, are you prepared to see that go to 10, 15? What's your idea here? So just information so we can get our package together.
No, I think those are excellent questions. As you pointed out, this has been an epidemic in the state of California. It's still epidemic in other parts of the world. So we can't really afford to let our vigilance down. And so this is a public health issue as well as a treatment and support issue for those people that are already HIV positive. Mr. DeLeon, did you have a...
I was just going to say, I want to thank Mr. Leno for his very articulate comments with regards to when you really frame it in that manner, that we took a raging disease and we've, turned into a chronic illness with regards to the investment that was done. It took resources, obviously, to do this. We're talking about lives of human beings, and depending on how we do this and the certain cuts that we make, if we do this very intelligently, we want to make sure, obviously, we don't go back to those days where all of a sudden the HIV infections are skyrocketing because of lack of outreach, particularly those subset demographic groups. I know I have in my district, for example, that would be prone to different types of activities and just HIV medication. So I really want to thank you, Mr. Leno, for the way you articulate it.
Okay, page 73 is the same item. It's the state operation for the Office of AIDS, so that will come back to us on that issue. And starting with page 74, then, we move on to state operations for maternal and child health programs for savings of $3.5 million, which conforms to action we took on page 66.
Or didn't yet, so
or
it
didn't
will
take.
conform.
Will conform, thank you. So we can move on to page 75. Pages 75 through 80 are another vote-only calendar. So I'd like to know if there are items that members need to remove for discussion or a separate vote.
No items.
I'm sorry, Mr. Dutton? Everything's okay? All right, then.
Which ones?
Pages 75 through 80. So I would ask for a motion to move all of them. All right, we have a motion, so without objection, we will record the vote as 5050, supporting adoption, and move on to page 81. Mr. Mibb, the Managed Risk Medical Insurance Board. That's page 81 is the summary. Page 82 is the proposal for the elimination of the Healthy Families Program for a savings of about $400 million in the Budget Act and $368 million in the May revise. So if I could ask the legislative analyst to start off by giving us some other options in case we don't wish to entirely eliminate this program.
Certainly. Thank you, Madam Chair. In addition to this proposal, the administration had a proposal to reduce eligibility to 200% of the federal poverty level. That's on page 83. The LAO also proposed an option to increase premiums for children and families over 150% of the federal poverty level by $8 to $13 per month, for a savings of $55.5 million in the budget year.
On the premiums, we just raised the premiums last year, I thought. Okay, effective this February, right?
That's correct.
So in September's budget, members, we raised the premiums effective February. So how much are they now? And when you say 8 to 13, does it mean move it from 8 to 13 or some range that you're prepared?
Sure, pardon me. Let me make that clear. For children and families earning from 150 to 200% of federal poverty level, they're currently paying $12. They would
per child?
Per child per month.
For a maximum of $36
maximum
per family.
Right. So three or more children is
36.
The family max. Right.
Okay, and these families are making how much? 150% of poverty?
150 to 200%.
So 200% of poverty is? 200% of, let's just understand what we're talking about in real world numbers. That's
Pardon
all.
me, I know, I didn't want to give you the wrong number.
For a family of how many?
Let's see. Sorry.
Who's got the poverty
For,
numbers?
for a family of three, we believe it's about $35,000.
A family of three is 35,000. Well, it's an average. I mean, it's a federal level of poverty, so it's what it is.
Okay.
So, I think that's what it is. Okay, so family of three, let's just round this off, 35,000. Family of three people, that'd only be one child, in theory, or two maybe.
It's usually one parent, two children is the standard.
Okay, so that one parent is paying $24 under current law, and you're suggesting to raise it from the $12 to what?
$12 to $20 per month. Per child.
And sorry, for healthy families, it's usually two parents, one child.
That's what I thought.
In CalWORKs, that it's usually one parent.
Yeah, exactly. It's different. Okay. But we just raised it.
Right. This is an option.
Raising
we
it to 20, not raising it by 20.
Right. Raising it to 20. This is an option we propose to maintain eligibility for the program and achieving some budget savings.
And the governor's lowering from 250 to, so what's 250% of poverty, just so we know what we're dealing with here? Because the governor's original proposal was to reduce from 250 to 200.
Mm-hmm. Yeah.
And what is the current premium for those that are between 200 and 250% of poverty?
And those are for a family of four versus the other ones which were for a family of three.
Okay, but at 200 to 250% of poverty, so what's the family number and what's the premium?
They currently pay $17 per month per child.
Which was an increase just this year from...
That's correct. I believe it was from 12.
Something like that, okay. So if we increase the premiums, would we not have to kick them off? I mean, I don't know how this all works, but some will drop off, but I don't know. How much did First Family kick in December to try to save some of the kids on this program? First Five, whatever they're called?
Senator Ducheney, I'm Leslie Cummings. I'm the Executive Director of the Managed Medical Insurance Board. And good day to you and the other members. It is the expectation that when one increases premium, that one will see a corresponding decrease of some sort in caseload. And we did expect that, and we did budget for that.
Did you see it, or did
we
you
did
just,
not see it?
It didn't lower, huh?
No.
'Cause the
Now,
economy's
it is
so
the
bad,
case
nobody
that
has
when
health
we
insurance if they
made
don't have
our estimates of caseload decrease, the economic situation was by no means in the situation that it is presently. This is an unparalleled economic situation, so it would be really hard to predict, I think, what's going to happen in the present based on what's in the past. But no, we did not see a decrease in new enrollments. As a matter of fact, we have seen the highest level of new enrollments.
Unemployed
that we have
people who
ever
no
seen.
longer have insurance for themselves or their families, at least can, even with their unemployment check, possibly pay for the health insurance for their children, even if not for themselves, under this program.
What we still are researching is what the effect was on disenrollments. And we think we saw a slight increase in disenrollments, but we really can't tell the long-term consequences of that for several months because people have 60 days to come back.
But we know for a fact that if we reduce the program from 200 to 200, from 250 to 200, that 250,000 children or so will no longer have health insurance.
That's correct. That's about a third of the program.
Mr. Dutton?
Yeah, on the rate increases that went up last February, I guess it was. When was the increase prior to that? In other words, how long had it been since there was an increase?
Rates are. Go ahead.
I'm sorry. For the population, we have 3 tiers of population. For the first population, that population has not had a premium increase since the program began. Lowest income people.
And still not.
And
right?
still not.
Okay.
That's at 100% of federal poverty.
That
That's
is
below
correct.
CalWORK's level.
No,
That is
there's been.
correct.
I'm just pointing. There's been no increase for
that
10 years
population.
or whatever.
And that has been a deliberate strategy
Right.
in our making our recommendations because the consequences at that income level are so much greater. The highest level of income, which is 200 to 250, had a prior increase about 2 years before the increases that took effect this last February. This last February 1st was the first time that the population group 150 to 200 had an increase, and then, as I've said, the second time that the population 200 to 250 had an increase.
In that highest rate, wasn't that the cap they raised, or was it the per child?
Well, in each of these, there's an amount per child with a family maximum.
Okay, so that it was a cap too. On the children that may be displaced on this would be another program that could be looked at as a first 5 candidate too, wouldn't it?
For a portion of the children are 0 to 5. Some children are going to be older than 5. In those cases, that would be outside the scope of what First 5 can fund. So it depends on a portion of the caseload.
It is the case that First 5 very generously, when we had a deficiency, and the deficiency was in the current year, was in part because of the timing of the budget was different than we had planned, and at any rate, and then also because of this issue of were we going to see a caseload decrease or not, which we had budgeted for. The First 5 Commission, both the state and the local commissions, very generously and without hesitation, stepped up and filled the deficit for 0 to 5-year-olds.
Okay.
It was $17 million, is our estimate. Of course, the year is not ended, but it's in that neighborhood.
But in terms of, Senator, if you're speaking to the 200 to 250, for a portion of those children, they're going to be 0 to 5, and so First 5 funds would be an option.
There's some option. What happens to like Title I funding for other programs like the CCS if the Healthy Families is eliminated?
if Healthy Families, CCS is, the CCS-only caseload would likely increase to the extent that the Healthy Families program is not there for some of those children. So CCS provides services to children to specific children in families with incomes below $40,000. So if the Healthy Families program is eliminated, then the CCS-only caseload, which is funded with a combination of state and local funds, would likely increase.
And if I may, there is a portion of CCS caseload that is associated solely with Healthy Families eligibility. Those children would no longer be eligible for CCS because their incomes are above the traditional CCS eligibility level.
Okay, thank you.
Mr. Blumenfield?
Some of my questions have been answered, but we talk about the bright red moral line on some of these things, and when we talk about eliminating Healthy Families, I see that line is very bright. And I think a lot of us agree. We had this whole conversation before about the elasticity of how many kids get thrown off the program. And as a parent of two young kids, I know that if my last dime will go into feeding them and their health care. And so we have to be careful, even if we can work it out in some way where they're putting their last dime in, what are we really doing to these families? So I just want to make that comment. Thank you.
Mr. DeLeon, go ahead.
Thank you, Madam Chair. Again, I just want to echo Mr. Blumenfield's comments. Clearly on the table, there's a moral issue here involved, but also, too, there's a fiscal issue. We leave on the table with regards to federal dollars, if I'm correct with the numbers here, $644 million is left on the table. If we take away our portion from the general fund, which is $368 million.
The program generally has a matching fund ratio of 2 to 1, so that is in the ballpark.
That's in the ballpark right there. And then again, we're leaving close to, $1 billion on the table. A little stretch when I say close, but, $1 billion on the table, federal funds to take care of these children who otherwise in the private market could not afford, through their parents' jobs or lack thereof, access to quality health care. This is an issue that I think we're going to have to leave open, and we're going to have to figure out and roll up our sleeves and see whatever cost savings we're going to go after, because leaving these children without any type of access to quality health care, especially given the fact that, again, Medi-Cal cuts as well as emergency room cuts, we are just putting the burden on the emergency room centers where these kids, as opposed to preventative health care, their parents are not going to be taking them to get any type of access to quality care until they have to go to the emergency room center. Once they get to the emergency room center, because of the cuts that will ensue there, they will be there for not hours, but maybe more than 24 hours waiting to get access to any quality care. So this is an issue that, Madam Chair, as well as members, that I'd like to keep open.
Mr. Leno.
I will be very brief. I know that we want to move on, and we're going to be keeping this open. I want to concur with comments made by my colleagues, but also just for us to remember that health does not stand alone. And we're going to be talking further about education. We've got to make sure kids stay in school, deal with the dropout rate and all. And if kids are going to school sick, they are not going to be able to focus on their studies. And if they don't focus on their studies, they're more likely to fail. And if they fail, they're more likely to drop out. They drop out before they finish high school, 6 times greater likelihood they find their way into criminal justice. So all the dots connect, if not only out of the moral obligation that we have to make sure our children are kept healthy, we need them healthy so that they can succeed, so that we have a workforce a generation from now. So this is not a small item.
Thank you, Mr. Leno. I, too, agree. This is the state of California, and we have to be able, I think we have a moral obligation to take care of our sick children and our poor children, and to eliminate a program that takes care of children that otherwise have no health insurance is just, to me, indefensible. I'm willing to look at cuts. I'm willing to look at other options. I know the LAO's office has raised a couple of options. I think there's maybe some others. We talked about the First 5 funding that might be available for children up to 5 years old. I think we need to have a package of options here presented to us where we can look at, and I believe Mr. Dutton mentioned another source of funding. I can't remember which one it was right now, but where we can look at minimizing the federal dollars we take away, we send away, turn away, and maximizing the number of kids that we continue to serve. I mean, this is 1 million children that if we eliminated this program would go without health insurance, would go without primary care, and would then go to the emergency room, would as Mr. Leno pointed out, go to school sick and potentially create public health problems. So, I mean, this is another one where we're turning away substantial federal money and we're shifting the cost somewhere else. So I will not support the elimination of the program, but I do want it brought back to us for looking at other options and cuts. Mr. Nielsen?
And do focus on the first 5 options for the counties, then, will
Sure,
you please?
absolutely. Recognizing that that serves a limited number of these kids that are on this program, but definitely should be looked at. And page 83 is the same item. It simply goes over the option that the LAO offered. Page 84 is the elimination of certified application assistance for a budgetary savings of $2.7 million. Adoption has been moved. If there's no objection, we'll record a vote as 5-0 on the Senate and 4-0 on the Assembly side.
Page 84.
Page 84. To move the adoption.
Right.
Okay, so it's 4-0 on the Assembly side with Mr. Nielsen being absent, and we'll add on later. Page 85, manage risk, AIM program coverage of private coverage high deductibles. This is an LAO proposal. Would you like to briefly explain?
Thank you, Madam Chair. Just to start off, I want to say that we actually withdrew this option for consideration for budget year savings because of some uncertainty in the budget year savings estimate. But I'd be happy to walk you through it quickly.
Well, if it's been withdrawn, unless somebody really wants to.
We're uncertain what the actual savings is because of the payment mechanism has changed for the Access for Infants and Mothers program. So the way they're paying out plans. Okay.
Yeah. Page 86, reduction in Proposition 99, funding for the Access for Infants and Mothers program fund shift to Medi-Cal. It conforms to other actions that we will be taking later or considering later.
It goes with the Prop 99. We've been taking action on the other 99 redirections, I think.
Yeah, this
Madam
Chair, Matt Aguilera for Finance. This is a proposed 17% reduction as a part of the alternative $60 million general fund Prop 99 savings option.
I mean, these are all bad, but, you know, I move adoption. I mean, this is an important program, but I think it has other funding, and keeping the Medi-Cal and Healthy Families base programs and clinics alive is kind of the base. So first 5 can help with this, too.
Okay, so we have a motion to adopt. Without objection, then, on the Senate side, it will be 5-0, and on the Assembly side, 4-0. Mr. Nielsen being absent, we'll add on later. Page 87, reduction in Proposition 99, support for major risk medical insurance program, fund shift to Medi-Cal. This is another shift of Prop 99 funds.
Move adoption.
Have a motion for adoption. Without objection, then, on the Senate, it will be 5-0, on the Assembly, 4-0, with Mr. Nielsen being absent. He can add on later. Okay, that brings us to 1240, and we can start on the Department of Developmental Services. I think we've got some time to do that. We were hoping to go until 1 o'clock, so, all right. That starts us with page 89, which is a vote-only calendar. So page 89 for members of the audience is a vote-only calendar. It's reduction to outpatient clinic at Agnews, D.C. for a savings of $192,000. Does any member need to remove this from the vote-only calendar?
I think
Just three items, pages 92, 93, and 95.
Hold on for a minute.
Actually, page 89 is the only vote-only
that's the
calendar
only
right
one?
there.
92 through
remainder-
96 are also vote only.
Oh,
That's what
I'm
he's
sorry.
getting at. It's
I'm
separate.
jumping ahead.
Yeah, you're jumping a couple pages ahead. So it's just page 89 that's
But
the
Madam Chair, I
vote-only.
think what this is not some new thing. This is Agnews. This is the final closing of Agnews, and it's a technical correction adjustment basically based on what the actual closing is and when it's actually going to close. So Agnews has been controversial in the past. I make that statement for the public. This is the final closure of Agnews, and it's a reconciliation of what it's taking to close it, move adoption.
Ms. Walters, did you have a comment on this item you wanted to make?
No.
Okay, thank you. All right, so we have a motion to adopt. Question by Mr. Nilo.
My understanding is we have on page 93, item 207.
But we're only on 89.
Oh,
We'll
I'm
get there when
sorry.
we get there.
Excuse me.
We're not there yet.
Okay.
89 is the
I thought you were
question
moving.
of the day.
No, just to...
Just 89.
To
The Agnews closure.
To clarify, page 89 is the only vote item, only item right now. A couple of pages later, we get to a longer vote-only calendar.
I thought you were on that one.
Page 89 only now. And I have a motion. Without objection, then, on the Senate side, the vote will be 5-0, and on the Assembly side, it will be 4-0, Mr. Nielsen absent, and can add on. Now we'll move on to a discussion item on page 90, adjustments for state developmental centers for a savings of $73.7 million. My understanding is this is a technical update to reflect caseloads.
Well,
Yes.
Madam Chair, the only question is, how much more savings could we get from the state developmental centers to provide direct services to the community? I mean, the other items go to all these other issues, but a lot of this is, we've had a policy in the state for some 20 or 30 years that says we're trying to move people into the community. We obviously know that these centers are the most costly thing we run. They're more costly than prisons even, which is hard to imagine in the state. But there are things that are more costly than prisons, and state developmental centers and state hospitals are among them. And what Agnews has been, it took us 5 years. Thank you very much. Ms. Delgadillo's worked real hard at this forever. But, it's taken us several years to close Agnews. Hopefully someday that 87 acres will be surplus property, and hallelujah, maybe Cisco will buy it, and one-time money, who knows. But in the meantime, we need to find as much savings as we can in here. And while the chair is right, these are proposed sort of technical adjustments. There may be more, I guess, is what we're trying to understand and make sure before we close it. I don't think we're objecting to the cuts that are on here. But I think we want to make sure before we close this item that we've found everything we can that can be then redirected into mitigating the community-based service cuts.
And we are looking at options in the developmental centers as part of the stakeholder process the department is working on to look at ways to achieve savings. It's not only focused on regional center side, it's also looking at developmental centers, so we can come back to you with that package when the stakeholder work group has completed its work.
For those reasons, we would hold this item open and come back to it. There is a stakeholder process, I believe, going on. Page 91 starts us into the Department of Developmental Services, Community Services, and Regional Centers. This is where we get to the longer vote-only calendar, members. Pages 92 through 96, and I understand there were a few items that someone wished to remove.
Yeah, I want to do 92, 93, and 95.
We're just staying off. We don't need to discuss.
Yeah, we don't need to discuss them. We're just staying off. And 95.
92, 93, and 95 are no votes on the Senate report.
Extensions.
We're just off.
Not
We're
voting
Just, yeah, we're just not voting.
on the Senate Republican side. All right, so then we would need a separate motion on 94 and 96. We have a motion on pages 94 and 96. Without objection, then the vote will be recorded as 5-0, 5-0 on both sides. And to go back and clarify on pages 92, 93, and 95, on the Senate side, it's 3-0. And on the Assembly side, it's 5-0.
A question, though, as I was beginning prematurely a few moments ago, item 207 on page 93 is, my understanding is that it is linked to item 213 on page 98, but that's not part of this vote.
207 is the baseline adjustment to the purchase of service budget. The other proposal is our proposal to work with stakeholders to reduce our expenditures, and that we're looking there at purchase of service regional center side, as well as looking at the developmental centers and potential savings there. So this is the baseline adjustment. The other reduces the overall budget based on the outcome of the stakeholder work group process.
And the action on this item is problematic if we don't accept the other. I'm wondering if we ought to go to the discussion item and then come back to the vote only.
Yeah. Very good for getting that in February. I didn't know that.
We can leave that item open. Was that page, what page was that again, 93?
93, let's just...
You can leave page 93 open until we have the discussion on page 98?
That would be the same thing, yeah.
Okay.
As opposed, if you want to take the vote, record the votes on everything else.
Yeah. We recorded the votes on everything else. On item 93, then we will come back for a vote when we get to page 98.
Okay.
Staff have that clear, because by the time we get there, I will have not remembered that we need to go back to page 93. So that would bring us to page 97. Is that right?
92 is 3030 or 3030? 92.
Not 90.
Right.
3 was kept open.
Got it.
It's 305.
Okay, so that brings us to page 97. Regional centers plan to reduce by $100 million in general fund. Go ahead, Mr. Cheney.
I just want to, we really, the department and all the folks did exactly what we asked them to do in February, and folks, really worked at finding these savings that I think we now pretty much all agree can be implemented in September. I suspect this needs to stay open briefly, or for the trailer bill issue. I don't know how to, earlier we've said, go off, do trailer bill. If there's a problem, come back. We could do that, or we can, but I don't know if it needs to be combined with the other stakeholder thing that's continuing, because folks did a really good job on this one. Unfortunately, we're now back asking for the, next tier, which is the other item, and I don't know how achievable that next tier is. This one I think is achievable, and folks did a good job, coming up with their own proposals.
And
I
this
don't
one yielded
know
a
whether
couple
the
of
trailer
million.
bill, it needs to just come back to us in some fashion. I don't think any of us dispute that we're going to accept whatever it is.
Yeah,
this does.
Ms. Delgadillo, can you bring us up to date on what those discussions are? And then Mr. Leno.
Sure, Madam Chair and members. There have been two processes using the same work group to look at the reductions. The $100 million reduction that's on page 97 all of the proposals came as a result of the work group process. Both houses have heard those proposals in Budget Subcommittee, and the trailer bill language is being finalized. We met with all your consultants on Sunday, so I think we're very close to that being completed. The $234 million, we've reconvened the work group, and we've been meeting fast and furious. I am cautiously optimistic that we're going to get there, although it's going to be very painful for everybody. These are very difficult program cuts that they're facing, but they've all come to the table and worked in good faith to do it. So we are moving at a very expeditious pace and hoping in a week that we'll be there and hopefully even have trailer bill language by hopefully the beginning of next week as well. There are some big issues we're trying to resolve. One of them is looking at the developmental centers. Another is looking at additional federal funds that we believe we can bring in that will help bring down the 234. So we're cautiously optimistic. We're meeting again with the stakeholders on Thursday.
Excellent. And this is the kind of process that I really favor, because it really, it's the providers that are working out how they're going to do more with less, and I appreciate that. Or not just the providers, but the folks that are all involved in administering these programs. I just would remind you, and I know you're working really hard, this committee is trying to complete its work by Monday. So for us to have a response back before then would be the best. Mr. Leno?
This is both good news, bad news. The good news being we've got a very successful model here. I want to thank and applaud Ms. Delgadillo for her leadership and her staff, along with our staff, and all of those who are impacted. We're talking about very severely disabled individuals and their families who are just trying to keep their lives in some semblance of normality. And we directed them after our vote in February to go find $100 million in unallocated cuts. They did the tough work. And we did hear this in Budget Sub 3, and we heard members of the community and their families tell us how even this $100 million was going to so severely and negatively impact their lives, and pleading with us not to do the $100 million. Now, once we've completed that, we're directed to find another $200 million. This is very, very hard and difficult territory for everyone involved. So I just want to, again, thank all those who participated and to recognize we've got a model that we can use in the future as well.
All right, members, those two items then will remain open, and we will be getting something back very shortly. Page 99 is conforming issues. Yes, Mr. Chairman.
We cannot pass this without the comment. Okay. $37 million is the finance identified cost of cuts in other areas. That's what page 99 is. And while it does conform, it conforms to all the stuff we've been talking about for 2 days, in-home supportive services, in-home supportive services we'll talk about later. But SSI cuts, adult day health, the discussion we were having yesterday about how we package providing a safety net. Here's $37 million we can save by not doing some of those things at some level. And we're going to have to figure out where that balance is and not add $37 million to this to cover for something we're not doing somewhere else that we've been doing for a long time. Just editorial comment.
No, I think that's much more clear now. Thank you. Page 100 will be our last page of the morning, members, because after that we go on to the Department of Mental Health. This is Restore General Fund in TANF for an additional cost of $42 million. And again, this is going to conform to other items. All right. Ditto, ditto. All right. This conforms to CalWORKs and whether it gets eliminated or not. That would conclude everything up to page 101, at which time we will start with the Department of Mental Health. So, members, I would recommend, we've got members that have meetings and committee hearings, and we've been working for 3 hours, so I would recommend we take a break at this point. That's to be determined. All right, we'll be coming back then from 4 to 6.